As we are on track now, at 11 a.m., we'll have a time for introduction and welcome address from Pu and Neihsial IDS retired Chairman V Lamka. Now I would like to request the Chairman to come over dais and take his own time, sir.
Good morning and Happy New Year to all of you from the Vision Lamka side. We would be expecting a few more people also to come, in the sense that we know all culture, and hopefully all resource persons also will be arriving, all of them on time. Since we seem to be having a little time, or more time in fact, I'll take a little longer of introduction and welcoming you. First of all, we are absolutely happy to see the beautiful and eager faces of our seniors, particularly our resource person, Dr. L. Fimate is already here with us. Then also I may mention that the newly created Suanmung Medical College Director, Professor Ibojaima, is in the midst of us. We are absolutely happy to have you, sir, here. And our topic happened to be something which is relating to them. Before I introduce the concept of today's theme, I'll take an opportunity of introducing and briefing you. What is the Vision Lamka about? And then I'll come on to the theme of today. Vision Lamka is a society, a registered society with the government of Manipur. This very idea came up somewhere and sometime in 2019, essentially from the people who are actually working and residing in Delhi. After interacting informally with a few colleagues, all of us have started having a burden for this town, which is nothing but a conglomeration of villages. Some of us have seen different cities in India. Some of us also have seen different cities around the world. What we noticed was that, particularly in the context of India, we found that the people actually settle first in various localities. People decided what should be the road, what should be the location of this and that, what should be the Nala system. And subsequently the government agencies come and nothing much could be done about it. If the roads and streets have been narrow, they remain narrow because concrete buildings have been already erected. If the roads are zigzag about it, nothing could be done because it's already like that. If Nala system has not been laid, it could be done, nothing much could be done. Because the municipal council or local self-government agencies, they come to extend the civic services like water supply, Nala system, electric supply, everything. What we mean to say is that by the time the government agencies come, the people have already spoiled it. That is not only in Manipur, but in every other part of India also. When things are to be improved at a heavy public cost in the form of compensations and all, have to be actually straightened and improved. We found that the same thing happened here in this Lamka also, Suanmung. When I say Lamka, it means Suanmung. When I say Suanmung, it means Lamka also. Please just understand that. If that is so, how we are going to make this beautiful town unattractive not only to ourselves, but even to outsiders. So that people can come and take a pride in visiting our city or town. People remember, and we also take a pride in remembering the town, even if we walk anywhere in the world. So we come to a conclusion that let us form a society. Through this society, let us try to create public consciousness. That if you are going to build a locality or extend locality, we must take care of this basic thing which cannot be easily changed later. How the road should go about, what should be the breadth of the road, how the nalas should go about, where a tree should be planted, where should be the footpaths, because engines, vehicles, and human being cannot share the same path. All those create actually consciousness. Let us try to create it. At the same time, while creating this kind of consciousness, let us also filter our thinking process by engaging the intellectuals in and around the city. That what are the points that actually we can put pressures on the government and public agencies, so that they can come and then do what it could not be done by the public themselves. This was the idea of creating this society. Accordingly, in 2019, we had one half-day seminar. There we invited one expert from Govt, who was a professional in this area. In 2020, we could not follow it up because of our COVID-19. Last year, we did it again in collaboration with PCCF, Government of Manipur, saying that in order to sustain and survive, we need to protect, improve, and create environment. So we fashionably call our seminar Building Green City on the Green Hills. It's not only in the town area we need to build a greenery, but we also need to protect the surrounding in this, which is surrounding this particular town. We consider that one a success because particularly we are doing with the forest department. In fact, they did help us also a little financially for organizing that seminar. Then this time, why we are actually choosing this particular public health and sanitation is because of the fact that we have gone through the country, not only the country, the entire world had gone through the COVID-19. And many millions of people have died. And when we look at our town, we found that this town is actually just ungoverned, not administered town. We are just leaving ourselves, left to ourselves. If I want to build a house, I just build it. If I want to make a road, I just make it. If I want to make a nala, I make it. But where it should go out, there is no any authority to tell me. What should be the breadth of the road in my locality? I just decide myself. If I am selling a plot particularly, there is no authority who would tell me that minimum size, breadth of the road in this locality has to be like this. The nala should be like this. Then we found that we are actually very, very big potential target for public health issues. God forbids COVID-19 do not come back to us. We are the potential actually victim for this kind of public health issues. And we also found one thing, that many of the people who live in this town are actually migrants from the hill villages, rural areas. In those areas, we found that actually people are working hard very day. And probably that was keeping them very healthy. After having come to this town, people do not work, not because they don't want to work, but the life is a little easier. The lifestyle change, We started drinking tea with sugar, no exercise, no physical exercise. And if you ask any elderly man of 50 and above, everybody will complain about blood sugar, which we call it lifestyle diseases. But then, in order to overcome those things, one is that we need consciousness. Second is that we don't have any facility where I can go for a walk. There is no park, there is no any kind of open space where I can safely do exercise every day. That's why we feel that there is a need for public health consciousness among the public. Then sanitation, as I said, is totally absent here. We found when discovered that this town, in spite of the fact that we are calling ourselves town or city, it is nothing but actually a conglomeration of villages. The villages authorities are functioning independently, if they are functioning at all. And there is no any kind of a proper administrative umbrella. How these actually village authorities should be functioning. A particular village actually throws all the garbage in the stream. For him it is neat and clean, probably by throwing into the stream. But beyond that, the next village, locality, he is receiving all the garbages which are being thrown around. And if you look the town particularly, you will see that in the lower side, like Rengkai, Jenhang Bazar, Sialmat, Marveng, and other places. Actually, tomorrow, it will become accumulation of garbages. These are the things which we saw it. Accordingly, we thought that this theme is very urgent. Let us hold a half-day seminar on this theme. Let us invite the best of the mind that we can think about it, and let us talk it, put our heads together. What could be done by the people? What could be done by the government? What issue can we take up with the government? Because of that, we have selected this one. Today, I am very happy to tell you that we have selected and managed to get the best of the mind on the theme. We have Mr. Vumlunmang, who is Additional Chief Secretary, all along who has been looking after the medical and health issues in the government of Manipur. He will be talking to us sometime. Then we have Dr. V Pau, who was the retired chief medical officer of the district, who knows in and out of the issues going around here in the town as well as in the district. Then we have Mr. Haulianlal, who is currently Deputy Commissioner of Pherzawl district, who had, if I know it correctly, the experience of looking after municipal administration in his home cadre. And of course, we have Dr. L. Fimate, one of the outstanding personalities, not only in this state, but also even in the state of Mizoram, who had held the post of directors in 2 medical colleges. Therefore, I would urge all of us to listen to their talk and presentations. And after that, we look forward to very, very meaningful discussion in the open house session. Let us put our heads together. We are the one who is going to create or uncreate this particular town. And let us think on that line. With these few words, I introduce the vision Lamka and also the theme of today. Please relax, please feel free, think about it. What can we do so that our grandchildren can thank us for having done something in our lifetime? Let us not thank ourselves. Please don't praise Vision Lamka for initiation. It may sound arrogant. Vision Lamka is not expecting for any kind of appreciation today We are expecting that appreciation should come from our grandchildren for having done something. Thank you very much.
Now moving on to the next, the first seminar, I would like to request Upa Dr. T. Vumchinpau, former Chief Medical Officer, District Hospital, to deal on the topic, Medical Sciences, Perspective on Public Health and Sanitation in Lamka, Suanmung town.
At the outset, I greet all the dignitaries present here, especially Professor L. Fimate, who is one of the resource persons of today's function, and Mr. Haulianlal Guite, IS DC Pherzawl, Director of CMC Suanmung, CMC, and Chairman and dignitaries and respected participants of today's function. I feel really humble to be one of the resource persons today, but since it is a medical subject, the Vision Lamka has entrusted me to talk on this public health and sanitation. And I have prepared some slides also. I'll just present in a few minutes, and also just to arouse or to provoke the thoughts. It's not the whole subject, but some of the perspectives. Because if it is a perspective, then something like the whole thing, the whole realm of medical practices, what is being followed for the public, is to be presented. It is what is my presentation about. Now, population, and this is a salient point, will not go and read the whole thing. Our population is 2,74,143 before our separation with Pherzawl, and our decadal growth rate is 20.29%. Decadal growth rate. We have a medical college with 100 students intake every year. This is one of the salient points. Now we have a facility like District Hospital Suanmung, one district hospital which is converted into medical college, and one sub-district hospital, SDH, and community health center that is in Singat. Primary health center, we have 6. 2 of them are health and wellness center converted, and primary health sub-center. These are the 52. Out of that 52, 17 are converted into health and wellness centers. So these are the basic health institution what we have, catering medical services and health services in the district. And we have Village Health and Sanitation Committee, Nutritional Committee with ASAs. We have 549 ASAs working on it. This is a brief about the District Hospital Suanmung in 1 year, that is in 2022. All the cumulative figure is 14,102 inpatients were admitted in this hospital. And in sub-district hospitals and PHCs, we have admitted 587. In sub-centers, though there's no bed, there's no provision for admission. Then regarding our data, because you may want to know what is the data, health data. That is why I just put it as health data here. Like first of all, let us say maternal mortality is one of the parameters as to whether the society is healthy or not. So I have put Manipur and India together. This is to Suanmung status. Per 2,000 deliveries, 1 mother may be lost, according to our status, according to our data for the last 4 years. Current data in Manipur is 64 to 80 per 1,000 live birth or live deliveries. Target for the 12th plan, that is 60. And in India is not put because we have put only in Manipur. Infantile mortality is 8 in Churachandpur, and in the state of Manipur 6. And we are planning for 9. And malnutrition status, anemia, mother with full ANC 82, then institutional delivery 92. 92 means in Churachandpur 92%. This is in terms of percent. Then delivery kits, delivery by skilled health personnel 92. Then child exclusively breastfed 76%. These are all percentages. Fully immunized 78%. This is the status of Churachandpur and in comparison to Manipur and India. Now we have vertical health programs and non-communicable diseases program. I'll go about slowly so that we can make it simplified. These are sometimes technical. That is why I just want to make it simplified. Routine immunization, National Center for Vector-Borne Disease Control Program, then revised National Tuberculosis Control Program, National Leprosy Elimination Program, NLEP, then Rashtriya Bal Swasthya Karyakram, RBSK, Rashtriya Kishore Swasthya Karyakram, RKSK, Home-Based Newborn Care. These are the vertical program that we are carrying out every year, every month, every day. So let us see the routine immunization, because this is a public health perspective. The healthiness of a society depends upon how much of our children are immunized, fully immunized and all. So pregnant women, number of pregnant women immunized with tetanus dose, that is 2,608. Then infant immunized, 2,618. Number of children immunized 1 to 2 years, 2,342 children. These are just to show how hard we have been carrying out immunization. Because we have to go headload, we have to hire porters like this to Henglep. This is Henglep area. And sometimes vaccine carrier could not reach the destiny. That is why we have to hire some carriers with the porters, hired porters. So this is in Bangai range. We have to carry through the river. Sometimes the asa has to be carried by the porters. This video, I don't know whether I can show it or not. Lastly, what I want to show is we have reached to the last of the village, to reach the last child to immunize. And especially in 2014, polio was completely eradicated from India. That is why in order to maintain the status, we have to maintain nil polio cases from 2014 for 3 years. It has to be maintained. That is why we have been carrying out all the IPPI and polio immunization to the last child, to the village, to the last villages. This in Henglep area, you can see all those things. Because if you reside in a village, these are the heads of the animals killed by the village hunters. That is why we are just taking picture of it, the children immunized. Now, National Center for Vector-Borne Disease Control program, this is for the malaria and rubella, measles, not exactly measles, but scurf typhus and all. So this carried by, and including dengue, is carried by mosquito. That is why we have been, this is active case detection. those blood tested for those people who are having fever, ACD, is for 7,170, and passive case detection, not necessarily having fever, but if they are residing in the area, if they are susceptible for malaria or scrub typhus, then we are testing. This is about 10,000. Then total positive detected. Actually, there is a program for malaria eradication, elimination in Manipur. But we have to have a nil status for 3 years maintained together. If we don't have any malaria case for 3 years, then we can call ourselves as malaria-free district. But we could not achieve as yet. So total positivity detected was 11. PF, Plasmodium falciparum, 5 cases. So percentage is 45%. So it's still very high. That is why, but in comparison to other years, the cases are very low. During our time in 1990s, 80s and 90s, our hospital, district hospital, is recognized as malaria hospital because the whole population admitted in the district hospital are given quinine drips. That is why now the cases are very rare. We have detected and medicines are also very good. That is why people are not dying because of falciparum if detected on time. A revised National Tuberculosis Control Program, RNTCP, now we call it National TB Elimination Program, NTEP. So for that purpose, OPD cases tested, number of positive detected 185, negative 91, number of patients treated 276. So with positive cases are still very high because we want to eliminate, not eradicate, but eliminate TB now. It's not a control program, but elimination program now. That is why detection has to be very active. This is carried out every day. Ongoing treatment is 96. Then National Leprosy Elimination Program. Leprosy cases are very rare now, and we don't detect cases now in Suanmung district. Now, Rashtriya Bal Swasthya Karyakram, RBSK, is 4D. Diseases, defect in birth, here, these are the main focus, defects in birth, because heart holes, like cyanotic heart diseases, and deficiency. Any deficiency will be tackled, and development delays. Like that, 4 Ds are taken together. So number of children screened, Asas and the Anganwadi worker, they will club together, they will go to the villages and screen children for these 4 diseases. And 36,274 children were screened. Number of schools visited by RBSK team, 189 schools. Number of Anganwadi center visited, 93. Number of children undergoing VSD, ventricular septal defect, atrial septal defect, squint eyes operation done, 17. So if the children are having these defects in life, in birth, they can be assisted by the government of India, and they'll have to be led to the best hospital for their operation, free of cost. Rashtriya Kishore Swasthya Karyakram, RKSK, is also one of the good, very best, one of the best program government of India has launched, but implementation at the ground level is not satisfactory, so to say, because here the youths will be focused for leading equity and inclusion in gender equity, strategy, partnership, and sectors. So adolescent participation and leadership is one of the focus under this RKSK. So we have 1098 peer educators trained in Suanmung district, and they have provided the adolescent girls sanitary pads and all, free of cost. Then home-based newborn care, HBNC, is one of the active work of the ASAs. ASA will visit the newborn child within 48 hours of birth, and if there's anything which is to be tackled in the hospital, then they have to refer to the hospital. So I'll just simplify like that, because these are all technical things. Now we go to non-communicable disease program under Suanmung district and Government of India, of course. National Program for Prevention and Control of Cancer, Diabetes, Vascular Diseases and Stroke. This one program that we are carrying out every day in OPD. Now the center is there in Neihsial Hospital. So NCD, we call it NCD Center. So everybody can approach there. Our chairman has just mentioned about diabetes, then cancer, very cancer is detected every week from Suanmung. And I happened to drop into RIMS cancer ward recently, and Suanmung out of 10, 4 are Suanmung. That is the problem. Nasopharyngeal carcinoma, then esophageal carcinoma, so many are there because we have malpractices in terms of tobacco, chewing, then Tamil and all. These are causing a lot of this cancer, besides diabetes and all. Let's go ahead. Now, I don't know. So we can attend NCD, that is non-communicable diseases clinic in Neihsial Hospital, Suanmung, for availing the services. These are attached with the medicine OPD. Non-communicable diseases like cardiovascular disease, cancer, chronic respiratory diseases. NCD causes considerable loss in potential productive years of life and losses due to premature death related to heart diseases, stroke and diabetes, and also projected to increase over the years. These are increasing data we have been encountering. That is why these services are available, and drugs are also given free of cost. Pradhan Mantri National Dialysis Program. We have 3 beds here. One is for septic dialysis, and another 2 beds are normal dialysis bed. And we have a total of 164 slots, but we could give only 21 ongoing dialysis. That is why people have to rush to RIMS or ZENIMS, because the beds are small and financial support also is very less. That is why they cannot do the whole slot here in Suanmung Hospital. But dialysis could be done here now. One is hemodialysis, another is peritoneal dialysis also. National Program for Palliative Care, NPPC. This is also one of the flagship program of Government of India, and this is very useful program because palliative means an end stage, at the end of cancer stage. At the end cancer stage, the patient has to suffer a lot of pain, and for that morphine tablet is given free of cost. This is very useful. You cannot just buy morphine also by yourself unless otherwise it's routed through the department. So this is a very good scheme. National Program for Health Care and Elderly also is being taken care of. Health promotion, preventive services, diagnosis, then daycare services, rehabilitative services, and home-based care. This center is also available in Neihsial Hospital, Suanmung. National Program for Control of Blindness. This is regarding eyes. So majority of the blindness or low vision is caused by cataract. 60% of blindness is caused by cataract. That is why cataract can be operated, and it's very simple operation. This can be done also in this hospital, Suanmung. Now turn to medical college, services will be better. That is what we have been expecting. Then National Program for Prevention and Control of Deafness is also there. So this is under ENT. One ENT specialist and head of department will be taking care of this program. So if you have any problem, then you can approach always to the Ccpur ENT department. National Oral Health Program, NOHP, is also there. This is regarding teeth and oral hygiene. Then National Tobacco Control Program is also there, but implementation is not very effective as yet. So we have been targeting more of the schools. So from the school campus, within 100 meters, no sale of tobacco is allowed. That is our theme, and we have been proposing also to all the schools so that no tobacco is sold in their nearby campuses. Then National Mental Health Program is also there under the Psychiatry Department in this hospital, Suanmung. So early detection and treatment of mental health and training, IEC and monitoring. So like here, Suanmung is very famous for suicide. And the yearly cases of suicide is being collected by NEST. Mr. Benjamin, he is one of the organizers of today's function also. They have taken every pain to take the data every year from 2014 to 2022. This is male and this is female. So out of 2014, 5. And must be 10-5. These 5 should come out. And here in 2015, 20 male and 1 female. 2016, 12 male suicide and 4 female. 17 male. Male is every time high. Okay. Now in 2022, 18 male and 3 female committed suicide. This is very embarrassing. That is why we have to have a promotion, a good promotion in terms of mental health through the churches, civil society organization, family have to come together so that this suicide rate is reduced drastically. Otherwise, this is very shameful also. Thanks for the courtesy of NEST, NEST NEST. They have collected every pain, all the data for us. Then National Viral Hepatitis Control Program is also there. In viral hepatitis types are there. Viral hepatitis type big tanalian de na thumina kihena. Viral hepatitis A, B, C, D, E, F, Z tan bangladesh maite kimulom lawina. A is specifically for children. If children are suffering from A, then it is curable if it is treated timely. Every restriction should be there, that they should not take meat, oily things, then they should take rest, and no tetracycline at all for hepatitis A, because tetracycline is affecting so much of the function of the liver. And B and C are also there. B is self-limiting and C is very dangerous. That is why all the medicines also freely is provided here under this. If people are suffering from hepatitis C, then liver is, there's a high tendency of liver being carcinomatous, liver cancer. Then chronic obstructive pulmonary diseases, COPD cases are also there. Then VIA colposcopy screening, genital wart inflammation, cervix, precancerous stages. These are the process of detecting the early diseases. Now, we cannot forget one of the most, robust health schemes. These are the health schemes. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, PM, ABPMJ, and Chief Minister Gihaksel Gitengbang, Chief Minister Gihaksel Gitengbang, CMHT, and also recently Chief Minister's Health for All Program, CMHA. These are implemented successfully here in Suanmung district also. Now, under PMJ, estimated number of eligible beneficiaries detected and registered are 179,065. Enrolled reported 61,000. Yet to be enrolled 117,000. And number of PMJ beneficiaries treated 9,650 patients. Amount spent on treatment is 14 crore. It's a big amount. So this is a very robust program that the government of India has launched, and many of the downtrodden people and also poor people, they have benefited from this scheme, health scheme. Thanks to the government of India. Oh, yes. Okay. All right. And Chief Minister Saksegi Sengbang, this also is equivalent to that of the PMJ. And CMHA, this also is one of the scheme recently launched. Thank you all. Thank you.
I would like to request our esteemed resource person to be still in the dais, while our volunteers from the Highland Group may they may kindly present the gift. The honor of presenting the gift may be done by our chairman, V Lamka. Okay. Haulianlal Guite IAS, Deputy Commissioner Pherzawl. He will be dwelling on public policy perspective on public health and sanitation in Lamka town.
Good morning to all the attendees of this program on public health and sanitation for Suanmung. It gives me great pleasure and it's my privilege to be present before all of you today. To be one of your fellow resource persons to speak on the importance of public health and sanitation with particular reference to Lamka town and the surrounding areas. It's a real privilege to be here in the presence of such stalwarts of our community, and especially this Vision Lamka led by Pu and Neihsial, who is the chairman of Vision Lamka Group. And of course, all the attendees and resource persons also. My fellow resource person for today, Pu Dr. Fimate. I had the opportunity to work together with him also a couple of weeks back regarding some program in Pherzawl. And it's a real privilege to be here, but I will not take much time because 20 minutes is the only allotted time which is given to me. And I'm grateful that Vision Lamka comes up with this important theme on public health and sanitation, which is particularly needed for our town right now, given the population explosion, either because of fertility or in-migration that keeps happening, and as well as the accompanied problems with rise in economic activity. For example, the pollution-related matters. There's so much construction activities happening in the town simultaneously. The increase in pollution levels due to every house having almost multiple number of vehicles, both two-wheelers and four-wheelers, and then sewerage, drainage and waste management, all these related problems. So it is from this broad perspective that I would like to talk a little about what we can do, what should be our priority areas or focus areas, and how should we go about doing it. Public policy, I had the opportunity when I was in Rajasthan, which being my parent cadre, I had the opportunity to work in 2 offices relating with municipal or city administration. One, I was a municipal commissioner of Ajmer for about 1.5 years. During that time, we had some good initiatives also, for which the Honorable CM as well as some other entities also awarded us some appreciation. We got some awards as well. And I was also the Secretary of Jaipur Development Authority, during which time I had more exposure to the planning of a city, and a city of the size of the metropolitan size of Jaipur. What we have in Lamka, on the contrary, is an entirely different thing. Lamka, we cannot exactly call it a city, although definitionally speaking, it fits into the definition of a city because the population is obviously more than 5,000, and more than 80% of the population is engaged in service sector, and the population density is also quite high. But in terms of the public amenities which is available, and therefore the public health as well as the sanitation measures which are necessary, Lamka has been lacking profoundly in several fronts, for which reason a forum like this is highly appreciated, and it should be held often, bringing together all the different stakeholders. By that I mean that in terms of population, our population is quite high now, it's more than 1 lakh. Population density is also high. Horizontal growth is much more common in our city compared to vertical growth, which may or may not be a good thing depending on how we look at it. Of course, it prevents things like urban jungles and the rise of urban heat sinks and all that. But on the other hand, horizontal growth of cities can also cause a lot of challenges, a lot of crunches on the public services, as well as prevent space, and environmental pollution can also be quite high. But before I dwell so much onto that, I would like to first give this appreciation to all of you that this public health concerns is always a multifaceted approach, and it should be approached from different angles by different stakeholders. There should be one integrating one focus area, of course, but different stakeholders are always involved, and it should be. The resource person before me had talked a lot about this various health measures which has been taken by the government, as well as the health services that are there. I would like to focus more on a holistic way to see how health is intricately tied with all the other amenities, all the other activities that we do in life, and how lifestyle measures can impact not just on the health services provided, but on the health of the city as a whole. So of course, about the public stakeholders, the important one, probably the most important one, is the government. And the government, we have several players, several agencies. One, of course, is the municipality. Since we don't have municipality here now, it would mean the district council that we have, as well as the office of the deputy commissioner. These, mostly it's through the office of the deputy commissioner, through which any type of public policy has to be implemented, since it is the coordinating force behind all the other departments. Then we have the political leaders in town, that would be the elected MLAs as well as the MDCs. And their input is particularly important because they are the ones who know the heartbeat of the population, of the civil population, and they are the ones who can communicate best on their side what their particular vote bank interests are and all that. Then we have politicians, we have bureaucrats, and then we have doctors. Doctors, of course, they will be directly involved in all policy plannings which are related directly with health. For example, in construction, in providing this or that particular health service through this or that hospital or through this or that health center. So we have the government as the main stakeholder. Then we also have the CSOs, that would be Vumlunmang would be one of them. Then other organizations, like-minded organizations, as well as organizations that might not be directly related with it. For example, our student organizations or philanthropic organizations and other organizations. These are also stakeholders who can have an important say and who can bring something to the table. Then we have the church. It's also very important. Our society is very much religious driven. So the church leaders would have an important role to play also in, for example, changing our cultural habits on how we should conduct ourselves publicly, on how we should, for example, treat those among us who have been unfortunately driven by needs of substance abuse, drug abuse, and other things. Then we have the business class. Business class are also important because it is the business class mainly who can provide the funding, apart from the government, who can provide the funding, as well as give the business class in a capitalist society are particularly important because they know exactly what the customers want, and usually what the customers want is something that is clean, fresh, sanitized. So they can give important inputs about it also. Then we also need the experts. By experts, we mean engineers, scientists, and doctors. Doctors, of course, both in public and private sector, they are there, and both their expertise is needed. Then engineers, of course, because public health policy has to be an integrated approach. We cannot just operate in silos. Different departments or different activities cannot be operated independently, whether through the office of the deputy commissioner or through the district council. All these different requirements has to be brought together. And for this, we also need engineers of different core experience areas, like civil engineering. Civil engineers would be needed for construction of drainage and other things. Mechanical engineers would be needed for plumbing purposes, sewerage lines, pipelines. Electrical engineers would be needed again for street lights, parks, and other places. Then we need computer engineers also to integrate the entire thing within the platform of IoT, Internet of Things, or by integrating all of them together, networking them all together. So we need lots of engineers. The engineers, I'm definitely certain that our society is sufficiently advanced enough to have engineers of different subdisciplines, and their expertise would, of course, be entirely needed. Then we need the public involvement also, so that the community mobilization can happen, because it will require a complete cultural change. That is a shift in our outlook, shift in our attitude, in how we interact with ourselves, in order to bring about a sea change in our public policy to make Lamka a true city of the 21st century, so to speak. Because it's not so much about the population, it's not so much about even the economic activity, it's more about how we do with less. That is how we efficiently conduct ourselves so that the city is clean, the city is safe, and the city is non-polluted. Now, focus areas. I would like to talk a little bit on the focus areas on how, of course, it's an integrated approach, public health policy, in order to have a robust public policy, but we have to focus on some areas that are doable or some areas which are essential. One area I would like to talk about is that we have lots of restaurants, lots of hotels which are now operating, but most of these hotels, I think, they're operating without FSSAI certification. In most cases, we do not even bother to get it. But food safety is essential in order to prevent all the non-communicable diseases and the other different types of diseases, diabetes and other things, or this diarrhea and other gastro diseases which are very common in our town, in our area. So for this, we need proper food safety standards. FSSAI insisting that every hotel or every food seller should have SSAI certification would be a way forward to ensure that our food that we consume are safe. Not just that, we have lots of our traditional food items which have not been branded, and fortunately it has not been branded. It means that nobody has a monopoly on how to make them. But there should be some standards on how we make our various fermented food like bekantu, sattu, and all these things, which are part of our food habits. And being part of our food habits, I'm also a big consumer of it, and so we can't avoid it. But in spite of it, it would be very useful to know what are the health implications of this. So doing a research, especially our experts, doctors and other scientists who might have expertise in this area, can do some research on how much impact these things have on health. That doesn't mean that the government or anybody should take our right to have this type of food away. It means that the awareness should be provided to us, the information, correct, accurate information should be given to us on what is the health implications of having this type of food activity, this type of food on daily basis or on this or that basis. For example, lots of independent global research has been done on the ill effects of tobacco, the ill effects of alcohol and all that. So something like that, eating too much of this, what we call king chili, for example, although I'm not an expert myself, I'm definitely certain that it will have long-term as well as short-term health problems if we have too much of it. So it will be important and interesting to, if the experts come about and study what are the health implications of some of the traditional food items that we have. So we need a proper food safety policy regarding this. First, restaurants should be FSSAI certified, and secondly, our food should be, quality checking should be done so that we know what are the health implications of it. The second focus area for policy is regarding recreational drug use. Lots of what shall I say, not exactly CSOs, but social activists among us have done commendable jobs in trying to prevent drug abuse, or at least prevent our streets from being flooded with drug abusers. Drug abuse, unfortunately, is one of the greatest ills in our society that is also extremely complicated and extremely difficult to handle. And there are different approaches to it also. Some states in the United States decided to approach drug abuse by fighting, for example, cannabis and all that, by fighting them, not directly, but by legalizing and decriminalizing them. There is one, I'm not sure exactly how applicable it will be in our society, but the effects, the long-term consequences of such a policy, although it's not known yet, the short-term results of it are quite promising. Because the moment you take the stigma as well as the allure out of recreational drug use by legalizing them, this is the same with alcohol also, by the way. It stops people, curious people, from exploring all this, from experimenting on all these type of drugs. Those people who are already addicted to it, of course, proper rehabilitation centers should be provided to them and they should be carefully monitored. But what do we do with the use of drug as such? Or what do we do with the use of alcohol? The government of Manipur, although the orders have not officially come out yet, is moving towards decriminalizing the use of liquor. And I believe that, although I cannot comment much on drug yet, but my personal research in this area tells me that it is much better from public health perspective if we decriminalize substance abuse like liquor. Because that way the government will be able to monitor the quality of the alcohol, the quality of liquor, and the sale in the black market. The economic implications on families will also be much lesser, and the revenue to the government will also be high. For example, I'll take one interesting anecdote that happened in Rajasthan. Rajasthan, it's quite a backward state, but it's not a dry state, it's a wet state. Liquor is legal in Rajasthan. When I was SDO in Mount Abu, given that Mount Abu is on a border with its border town with Gujarat, and Gujarat is a dry state, Mount Abu is the second most visited location in Rajasthan. The reason is that every weekend we have these Gujaratis flooding Mount Abu for drinking purposes. So it brings lots of revenue to the state, which Gujarat loses. Thousands and thousands of crores Mount Abu alone gets through revenue. But it's not just about the revenue, it's about the public health also. Because the moment you regularize it, it means that you can monitor the quality of the distinct liquor that is provided. And that is very important. Otherwise, if you criminalize it, it means you can't monitor it. It means you can't know what is the quality of the alcohol that is provided, and that is causing all the different types of cancers that we're talking about in a far worse of manner than it would have been otherwise. So the use of local wine or local liquor, the production of local liquor that has all kinds of different polluted chemicals, toxic ones, extremely toxic ones, this can be prevented through proper regulation. And the same might apply to recreational drug use also. Recently, after my mother passed away, my mom was buried in this cemetery in Lamka Cemetery, and was near the stream site that her grave was located. Her grave is located. So now and then I keep visiting that area, and I notice that most of these drug abusers who have been kicked out of Terim Road and other prominent places have shifted towards that site. It's quite a sad sight to see. But I believe that it is a movement in the right direction. At least it's a good thing that they have moved to a remote location rather than being confined to this area. But in order to rehabilitate them successfully and make them productive members of society again, it is important that we improve our rehabilitation centers by providing, for example, job track skills like tailoring, carpentry, mechanic, and all these things, or even computer training, where they can work from the safety of their rehabilitation centers itself and also pay for their own expenses that way. So we have to focus a little bit on that as well. So drug abuse as well as substance abuse, these are particular areas of concern which I believe that we should really focus in and concentrate in, so that there is a proper civil environment in which we can talk and deliberate and how we can come up with the best policy. The third area, of course, is public sanitation. I don't know if you notice it, but in the entire town, maybe I don't know about it, but as far as I know, there is not a single public community toilet that can be used which are open to the public. Right? Toilets should be built, and not just built, toilets should be paid, toilets should be given. When everything is done for free, like in a socialist paradigm sort of thing, nobody takes care of that particular resource, that particular infrastructure. Right, there should be paid toilets, the government should build them and maybe outsource their operation and maintenance to some groups of CSOs or some public well-wishers, and public toilets should be maintained properly so that we can use it. Drainage and sewerage lines are also a problem, luckily because of the Neihsial road that's coming, and the focus on drainage lines, sewerage lines has also increased. But we must insist to our elected representatives and to our engineers also that every time they are going to build roads, they should always start with the drainage lines first, and either that or they should not stop the road construction until the drainage lines are completed. Right? You may have very good roads, but if you do not have good drainage lines, then your roads will get damaged in the next season. We live in a tropical area, in a subtropical monsoonal region. So road damage, given the type of quality of roads that we have also, is a given. It'll happen sooner than later. So having proper drainage lines will go a long way towards preventing this type of thing from happening. Then again, we also need an integrated, holistic approach when it comes to making drainage lines and sewerage lines. Because what happens is, I noticed this in Rajasthan also, in some places here also it has happened, that one particular department, for example, PWD comes, build the road, then another department like PHED comes to lay down the water pipelines. Then in order to do that, they have to dug up some roads which have already been constructed. So they lay down the pipelines, and then the road remains unrepaired like that. Then some telecom companies will come to lay down their fiber optic cables. So then they will dug up which the PHED people have dug up. Then some pipelines will get destroyed in the process. It will be left unrepaired. And after that, maybe we haven't had that advance yet, but maybe someday also we'll have gas pipelines also coming, if we can have gases to our house. So whenever these public utilities companies are coming in, or public utility services are provided, the same roadway, the same right-of-way is being used, and for that reason, multiple times it has been dug up. It wastes money, as well as it causes road damages, which hurt the public as much as the new improvements do. So an integrated approach is needed at the government level, at the planning level also, so that all these things are being brought together and the same work does not have to be done multiple times. Another important thing for the growth of Churachandpur, which hardly any attention has been paid, is regarding waste management. Maybe we do not produce enough waste yet. I do not know what is the actual picture. But there are two types of waste management. One is solid waste management. The other is grey water management. Right? So fortunately, we do not have much of grey water because we do not have industries, factories to pollute our water. The only grey water we have is mostly septic water. And as far as drinking water type of waste are concerned, they are not considered to be that much of grey water. But grey water management is extremely important. So a research has to be done on how much grey water is being generated by our town so that we can have a proper STP, sewage treatment plant. It can be a small plant like 1 million mld plant type of plant also. But once we do a proper research, we'll be able to tell how much sewage treatment plant we require. And we have to manage that. Otherwise, the little streams, the tiny streams that we have, which are already disappearing, are going to become even more polluted, and they are going to disappear even more. So proper grey water management is essential. Next is solid waste management. Again, I understand that there are some community interested persons who have done something in this area, who are collecting garbage and other things. But in addition to that, we need to have proper drainage lines, which will in turn also have these collection centers for solid waste. And we should not just keep this solid waste in dump yards or in trenching grounds, which we are currently doing right now, if I'm not mistaken. Trenching grounds are extremely hazardous for the environment. They are hazardous even for our public health, because the chemicals and the toxic, which are mixed together with toxic waste, with solid waste, if it enters into our water supply line, whether through streams or through seepage underground, that can impact on our health in the long run. So we need a proper solid waste management plan. Now there are three different types of solid waste management plan. One is converting compost into converting to compost, right? Solid waste to compost. Compost is used for things like fuel purposes. So that is one possibility. Fuel purposes or this vermicompost type. So it can be used for that purpose also, and it can be sold back to the society. That is one thing we can explore. The other is, and this is more successful in Rajasthan, I suspect it will be more successful here also, converting waste into electricity. Maybe we do not generate enough electricity, enough solid waste yet, but some electricity amount that we generate also will be sufficient to build, for example, a small power plant and all that. So we need to do a proper research. We need an experts to do proper research on how much solid waste we generate, how much grey water do we generate, on the basis of which a plan can be provided through our political leaders to the policymakers, to the bureaucrats and other people for the construction of sewage treatment plant and for construction of this energy producing plants. Waste management, until and unless we have proper waste management, until and unless we have proper drainage and sewerage lines, until and unless we have all these policies in place, our city cannot really grow. It will remain polluted, it will remain dirty, and it will remain public health will be unfortunately pushed to the back burner, and our life expectancy will also be quite low. Then a final area that I would like to talk about is regarding public health policy. We do not have, unfortunately, every important city. I was just looking at this vision document that was given, and at the back of the page, if you look at it, you'll see also how the value of property increases worldwide. This is a self-evident fact, but they have concretized it in terms of quantitative numbers. That the value of real estate also increases if there are parks or recreational locations nearby. Our city, because it's unplanned, it just grows through completely unplanned manner. There is no building bylaw, there is no zoning system here. And building bylaws is also another thing that I'd like to talk about just before I end this presentation. Our city, at the city proper, I think in future, we cannot see that much into far ahead, but I think in future it will become something like the old city part, because there are no parks. We do not have a single park in the entire city proper area, and that is the most unfortunate thing. Which means that the elderly population among us, or the children among us, in case we want to take them out on a stroll, we have to take them in dusty environments, right around the streets, which are unsafe. Lots of congestion is there. Accidents are happening on a daily basis. Then communicable diseases and sanitation-related diseases, whether it's cold or other things, they keep happening, and these things will keep happening until we have proper park facilities. So I do not know what would be the solution for this, because the real estate prices in Lamka are exorbitantly high compared to even in cities like Delhi and other metropolitan areas. But the parks that we have in far-flung areas, I think that's where proper city planning can be done. But if we do not start now, I mean, Lamka proper maybe it's already so much of a hopeless case, because in order to just even expand our main Terim road, it's going to cause so much political friction, and I do not know whether we have the political will to actually execute that as well. But well, we can always surprise ourselves in a good way. It will be a different thing. But otherwise, I cannot foresee how we can have a public park in the city proper area. But we do have some parks now in outskirts, like in Mata's side, we have a number of parks. And these parks should be made as public parks. They should be monetized in the sense that, for example, children and senior citizens, it can be free for them. For the rest of the people, we can pay for the park cost. And that way, the funds that has been generated can be used to operate and maintain in the park. What we need is proper parks for our elderly citizens and for our children to take a stroll for recreation and other things. We definitely need that. And possibly because we are not a municipality yet, we do not have building bylaw. But building bylaw is also another thing that is needed. First time I actually came back to Manipur to work 2-3 years back, one of the things that shocked me was how rich everybody has become, compared to so many other places. That if you look at not just at Terim Road, most of the road, Tipaimuk roads, Nerumak, and most of these roads, including Vietnam, much of Vietnam also, it's hard to see buildings that are not made of concrete, right? Nearly all buildings, virtually all buildings in Terim Road, you'll not find, if you look all the way from Forest Gate to even this FCI go down, the entire stretch, there would be not a single wooden house anymore. Which is a good thing. It means that lots of money has flowed in. We have gotten richer, much richer than compared to previous generations, compared to even 10 years ago. But without proper building bylaws, we are building all these concrete structures everywhere in the entire campus that we have. For example, if our plot of land is 100 square feet, then we're building it on 90 square feet at least or something. There are no room for trees, and in the absence of room for trees, if we keep continuing to build like this, then there is absolutely no way that we'll live in a public health environment. So the environment would be highly unsafe for us, too much concrete jungle, and would lead to lots of pollution. And this type of measures, we have to find a way to curb it by having proper building bylaws. So we need to spread awareness about the importance of building bylaws and having a proper zoning system. For example, different land use. Now, even in Manipur, in revenue areas, although Churchandpur is more or less like, the town area is more, Lamka town area is more or less like a revenue area only. But we do not have land conversion system, for example. We do not have a proper land use system. So if you have an agricultural land, you just plot it up, divide it up, and make it residential, residential plots. If we do not regulate this properly on how we are occupying our land, and how every plot of land becomes something like a residential plot, then there's absolutely no way that our city can become a city of the 21st century. Best, it can become some glorified slum area, like those famous Mumbai slum and dwelling settlements and all that. So we need proper city planning, and that city planning is directly tied to public health sanitation. I'll end my presentation here. Thank you for the patient listening.
Dr. Iboyama, CMC Director, will do the honor of presenting the gift. Thereafter, we'll be having a tea break. Our volunteers of the Highland Group will be serving tea inside the hall. And for a flashback of the activities of Lamka here, that can be watched on the screen. And we also landed our respected Additional Chief Secretary V Vumlunmang had arrived. Just after the tea break, we'll have the key address.
Thank you to Vision Lamka for inviting me, Chairman Pu Neihsial, Secretary Pu Chinsum, and all the office bearers, all the members of the Vision Lamka. It's my pleasure to be here, and at the same time I apologize for my delay in arrival. Today is Manipur's statehood day, so there's an official state function which had to be attended. So I apologize if the PPT can be put up on the screen. I have a very short, Tunini keyon gen didan de topic on kipia here public health and sanitation here. Resource person tena tamtak point again ta diun kaging ta public health to kisay bang in leng Dr. Pu Vumchinpau in hi health program to te details kong bang legendin kaginga kenikon gendan hi a general so de which ham chi khaton hi som ka here wana sanitation chi ham cleanliness bang leng tam ta ka ki gen ta dinga keyon gen tupdan hi sawa gen lo ding to khat ve ideal a hoi Ivangim sang lot chele to ki khelwain ken khatte gen dan de sab gam vam gui te bangin le bang cha India dop di chi kha buai huai khat om dan de uzia kin hi bang hi the om banga hi pan lak na di chi pen hoi to link up dan om the ham chi dan de lama hon idea ki kumle chi dan ka hi next slide ye kha neu kha ngai to jek leng ka u te hi health hina sanitation hile government mo puang na thama asanin lekon ko izojena wai hi I deny ke ya I ken leka deny ke ya a thama hilele adia kina hi slide hi cleanliness and sanitation lam focus ka ud na hi wai lam deny lo kom mini hi ai noi lama you ichi ya me ichi ya ke ichi ya le omi hi chi kha ki phok thak le uthoi ka sa wana dia kina to I all sanitation chi hama cleanliness chi hama hi gendan khata ki gen hi le hi a waste generator hi eite hi zodaya ami mal khat kha in veng pale hi ma e kha ki hi phote chu thil tam daga kha lai siang thoma ma le in veng pa iu naw pa hi diklo te mu hangai le ma sai hi ya hi a full range yet na hi pen kha ki phok ma sale uthoi sa ke ve tun ei te lam ka om lo hi le khai cha avek a green din chin leivui le om lo di hing di dip di ei hong ten dim chiang a kham mun khen kha ta in lam mu thanga mun khen kha ta bang hem hi u ja ka va to hanga va hi buai hanga inin va pai hanga gendan kha ta gen di le tu ni na phok le de hoi ka sak chui bul pat na di na a waste generator ichi hiam ai ke le anin piang sak tu ichi hiam abuai na bol tu kha gen dan khatin eima hi thoi ve wai kha hiya ya tuang ki lang ting kha bang chi ni pang khom de chi pan khom na lamai pai ke le hiai thil kha fel ngei lo de ja kina tu ni na a government kia hiam ai ke le ami dang de kia hi zo loina ke le ki involve ka hi chi na ya full range kha phok chiang ma le resolution te bang phialina ilung sim mimal lung sim ai chiang le de hoi ka sa a government ni chen na DC lambang I focus focus a responsibility le thama wana dialogue hi district level officer hi wa hi department te chi na hi maya ke department lenga hi dinga state government CM ka hi na district level officers te bang le CM loi sakluat na bang lom hi mai the wana MLA te le lo the loina solka la te le hi wa wana NGO te bang wana Lamka area bang hi private business bang long khang sot ma yai bang le hi sanitation and cleanliness and ni chi hi amau le bang chi banga a om diwa bang chi banga role ni diwa chi hi poimo ama wana family oma district council aban den cha kon gen dek ja kina tam hi ka gen lo khi de wana ki chi na hi Lamka om te le Lamka om lo te yai bang le khen zek ut ka hiya Lamka om ten kha thil khen khat kha ki all mo khol het lo ลำกับพวกลำอมเตียนละฮอนปุ่มอลหมอปิวไว้บ้านกี่บาลานซ์เราเดียวขัดต่อมินชินลำกาอมเตียนเลยออลหมอจะเดียวหินะลำกาอมนายเราเตียนเขาจิเราเตียนเลยฮอนออลหมอกี่จะเดียวเห็นล้านไอ้กี่เลยละฟันของโตสกีมของโตมาชินารีโตของรูทเทจีฮิเลวจูไว้จู most welcome มั้งรูจีฮิเลวอัทัวกี่ welcome อัทัวกี่ออลหมอลวดของไอ้จะเลยจะข้ามไอ้ลำเจ้าเด็กฮะอันนักกิกลัวจีดานเดียวบางลมเทียนเช่นว่าจะไว้บ้านเล็กบาลานซ์ไงข้าต้มไว้ all the stakeholders have a role จีข้าเฮียสไลด์ประกาศกระทุบเฮียอาขัดเตะเกียกว่าเฮียมเตะฮิดิเกีย district council และ town committee เตะฮิดิเกียเลเฟลโจตัวนเราดิอีเวกข้า waste generator อีจีฮิอป่วยหมดด้านจูคนเขียนเล่งตัวข้าเอ็นจูนุยซาถอยสลายเวสาบกามาข้าหวยคอนเซปต์ข้าอลุงซิมวัชียนลวดเจียข้าอากามัวเซียนดานละเอ็นเล่เดย์โลซามฮิเลนุยซาถอยสักเดตู for example เป็ดอันนี้ว่าเล่กันอันนี้ว่าเล่อุยเฮียมโจงเงียวเฮียมอดียกินอุยมาข้าหานี่ว่าคนละกับปอดปิว walking เดียปอดปิวว่าเล่ปากของปอดปิวว่าเล่อุยอินเอกทักเล่ไว้ข้าปิกาปุงไงเว้พลาสติกเบกกิเกนุนจินอพุเกตข้ากัวอุนจินเป็ดอุยเฮียมุนะปากเฮียมลำเกียงเฮียมเอกทักเล่ปิกาปากัวอินจินอินาตุนจะดัสบินดิกับไปเว้เอ็นจุงไงตัวเลยไงตัวอุดโลดิจิเพียลดิมั่วตัวนี้ค่ะฮิเลเลกีบอลที่เดฮิจิกันลงสิงอมนัสันค่ะตัวนายไอโซละก็วสินเล่ข้อตัวเข็นคัดติดตกที่จะเฮียท็อปิกเลยตัวนั้นเราโฮลิมขางนาค่ะฮิปันตาฮิวจิซาเกเวลำก็เต้นยังไงสั่งเป็นค่ะมิโซรัมฮิเพียเลยทุกวังเจียมขตาค่ะที่เต่งก็ฮิดิคิเลวกิโลมแต่บางทีไงตัวเฮียลำมาเตะจังว่าที่เต่งค่ะอลุงซิมุเลติกโลดีบางไงก่อยมั่วเอเมเลเตของอินช็อตมิโซรัมลำเต้นเลยไงตัวปันทีตาไว้เละหุจิบังเขาสูงกิเซียนนะเดียอีวาสินเล่นนปนวมปันตายไปตัวเมากำค่ะชิลองบังเลยที่เท่าว่าจะกินค่ะ waste generator ที่ responsibility ข้าสานะสั่งข้าตัวไม่เว้เดินจะบานี่เขียนแต่ next slide ลำกาอมเตอาดิลเฮียคนเกลค่ะมีออนอัดไวส์เลยดังที่อพอลมาที่อีเกนบางขัดไหลนะคอนเชียโซไหนลูกมาฮีจินวมเกยเวอัตตมโซเตียนค่ะอินสุงนินเลยจะค่ะอิมิตินมุเทไหนโลดัสต์กิจิบังเลสิงเฟรมเตของตุกเวทเฟรมของดอกการตุงของอันโนลาไซด์บอร์ดตุงอมเตของค่ะอิมิตินมุไหนโลลอยฮีจินวมเกยเวตัวนี้นะเฮียไปคอมเตนค่ะเวียงเจียดอินฟลูเอนซ์ที่น่าเจียดค่ะนีนแตกลดีฮิเลนีนไซเฟลดีฮิเลอันนีนเขาเลยมุ่งง่ายมั้งอิมฟาลา government colony ตัวมมินชินลำก็ลำเตอมเดวนักวอเตอร์เตะค่ะอดังเตะเสียงโลโซยเวgovernment quarter type 2 type 3 construction กี่บังมั้งฮิเลเลoccupant เตนนีนอิจิเฮียมเก็บเสียงได้อิจิเฮียมหอย consciousness ค่ะอีกขั้นโตสักเดียวกี่เละหอย colony ขัดสุ่มมาquarter กี่บัง same construction อาเซียนด่านเขากี่บังโลขัดต่อไม่เว้ว่าจะน่าตู้นินฮิเข็นขัดเต้นจุกปกตาเกลำมุกวาลบังเลนวามไซงะเวงเข็นขัดข้าเละละมะI'm very optimistic เวงเข็นขัดและมีเข็นขัดเตอินข้าเสียงหิวเหี่ยวปากเละกรีนพลานสักข่อยด้านบางว่าจีนด้านบางว่าเละอันนั้นละนักข้าค่อยเหี่ยมาเฮียgreater Lamka ที่โซเซนเลยเฮียข้ามุดิอมได้เวอินกงเต็งบางว่าเละเสียนด้านของcompound สงไว้จะพลานจะหิด้านของหอยตักอมได้เวว่าใจนะเดินไอโซลำเตเลกิมูวาปุอิจิเตบายน์ข้าลำกันละกันเลยหุจีอมปันตาหอยตีของไตมาฝ่าด้านนักอีเวลำกาคัดอีเป้ากับห้อยโลขัดอมไม่เทโลของชิมอกมั่วมีไตมาเตะข้ามาจะอมไม่เทโลว่าชิมอก develop society hi mi makwa ma om mai lo piwa e loi kha om mai lo zo zen hi zoi ve in kep siang hi na livelihood ina bangkim hi le hu chi te kha om zek tai ve wai la ka ki pa hwai ma hwai kha tam sem hi som le garbage phok wana village authority in ei diu dewa tu ni na represented bang le om mai thei dinga veng khen inin saidan nu kha Lamka hi na Imphal lam hi le garbage collection system kha hin chin NGO chi hama private party tuam kha local authority te na area pia ko min hwai kha fee pia di hin chin amau kal kha ta khat ve hiam chi khong a van hiam mo truck hiam ong khonu hin chin veng khen kha da kha khen kha tin kha hwai fee pe ut lo ve wa zakat hiam za le som nga hiam hi mai the hi za kha hi bang le service hong pe di hong ki sao mo le a business su kha i hi viable sak ngai sa mai ve in zani om le hwai atam zo ten bang ja ka ni dang la ye na piak lo ja ka chi dan de uma om di dan ne ki ngai to cha kha i ngai dan bang i ngai to dan bang le khen ngai i hu chi ke le chu en hiap pa tai i na pa tai puak khia ka huai ya i nin pai khom na kha i se kon no se ken se ken ngam la sim pi ve ava pai na di tanu kha wai bang va hi wang la ki le chu okay khatengai phiak khi le poi lo wai le hi dek lo di lui kyang kho pai som lel khai yanga wai ja ka social discipline bang le ki piak ngai khatom mo village authority a din mun nei te bang yom le i kho sunga member tengin kha chu nin nei het lo om le la nin nei lo bibek household kha chu exam thei dai le hu chi lo tengin kha chu hai bang le hi ngai om in chinว่าขันนี้ลำฮิพอดเละอันหลังขัดลำขับ public health เละเนี่ยค่ะก็ตัวพี่ก้อมเสียคิดนะว่าจะกับ department เละเลยเฮียก็หมอบพวงนายเฮียสาปาวินะ health seeking behavior อาชีวะ public health expert เต็นค่ะมีปีละก็เด็กมาค่ะมีปีเต็มมีมัลเชียตินค่ะ health seeking behavior ในเลงที่ย้อนเด็กมาเฮียดำโลนายเฮียบางเฮียมีในเละไว้เกียรติศักดิ์นาหัวนะดำโลหุดเกียร์ฮิโลยนะ wellness concept ไอ้ตะไคร้ลอยข้าดำสมโลยามจีนบไว้เพียเลยเวกะจีนาจูอีดำหอยจอยกิลาเมนเจียที่ทุ่มนาเลยฮิเลเลอีหุ่นจัดด้านเตะของอีเนกด้านเตะของอีโดนด้านเป็นช่วยเลยเกียนเกลเลยไว้ท็อปิกจ้านิวทรัลมาก็เฮลเกนเลยไงเราว่าจุลอินเอกด้านบางเลยมั้งอีไว้กำคงกับด็อกเตอร์เด็กอย่างนี้หอเลย red meat เนกเราดิ don't eat red meat don't eat red meat ทนชิวมั้ง chicken บางคนผัลหามมุจิดานเดียวเห็นจินอี health maintain นะเดียเฮียละมาจุเอ็นค่ะ red meat จีงันเนี่ยนิตากันเนี่ยดิ next day เนี่ยนอนดินิตากันเนี่ยนอนดิเน่มั้งเฮียบางลีกี educate ตัวขัดง่ายว่าไม่เว้จานละเมนมุนขัดตะเกียนนะนี่ดังลายสิงต่างควายเต้นลายว่าสิงต่างขวาไลฟ์สไตล์ตัวตัวลายลำกะจางลำกะเอเรียไลฟ์สไตล์quiบางนอนโลอิเซียกะอีโซเชียลแฮบิตส์เล็กกี่เข็นไงอีฟู้ดแฮบิตส์เล็กกี่เข็นไงสิงต่างขวานี่เต็งฟิสิกอลแอคทิวิตี้โลกวนเตไอ้แกเลยกำดังบางอะไรสตรองฟิสิกอลแอคทิวิตี้นี่ในที่อาเดชูมีดของหาเนกเลยปล่อยโลวินจินเอลอยลำก็ละกะยมดานค่ะสโตรกปุ่นดานบางมั้งสโตรกตัวขาเกณฑ์เด็กเลยเกณฑ์ที่เจียบเพลดีเวตู้จิงกาเลยขัดกระบวยผิวสโตรกบางเลยตัวมั่งบีพีน่ะสร้างลัวจีบางไดเบติสกุมหนาวปังจิกระบวยปันตาจิเตะของค่ะมีมันละมาปัดเลยโซเชียลเลเวลเลยอีกีเอจูเกตง่ายค่ะตอมดรวีซีปาวินเขาไว้กำมุดานี่นะสกีมตัวเตบางเกละ government ละมาปัดจุนัดจิตเต็งเพียลค่ะcentral sponsored scheme บอลเขียฮิตาตัว non communicable disease ที่ว่าไว้บางอาคาตัว BP เต diabetes เต cancer จิตหุ่มเตของและดังค่ะฮีของอมตาวันน่ะ malaria ของ TB ของไอ้และสอดตะปะตะอมซาเฮียวันน่ะตุลายนี่คิดนี่ลำบวยบางเลยคิดตั้มสดมา dialysis program จิตของตั้มตะของอมฮิเลเลยหวยเป็นค่ะอีดำโลหนุ่งถูหินสินตู้นินฮีเฮียแพลตฟอร์มตุงตัวน่ะกระตากหลักนอพี่wellness ลำเลยหาเดลง่ายเว้ยอาจจะตูตะกะเขาอีหาเดียวขี้เละ lấy vui là cái hào lo mà rằng là ví dụ là mà bắt thu gen pa khát tông gen khăn gen khâu mà ngài cái tê khát chút cái cuốn nghèo mà ấy à again khai le dik ma hin chin na leivui nei da nu na lampi din mono point thum le lion gen in chin adon na diom lo ki kun hi mai hilel huai survive so mi zia ka kha huai survive so mi chang kha I hat deu mai ke le ma huai jaina tu ni huai saw lo in ka gen nuwa ma huana the next point huai ka gel pen hi nanga secretary hi ve chin nang control in non chin wa moi mai thei di nga ka junior zog de ulai na khat ve hi district hospital ko hoina a hi le grade 4 le pion bangza hi mi ha posting oma chi kha kadong kha kum som hiam pai ta hi a I district hospital kha grade 4 le pion hoi muna posting mu chi dia hoi muna om kha som sagi na phawi ve thì kim đấy kể điều trị khá cho cái gen ngài lâu là nô là na thế mày điều à igen nó tu hay bang le social control chi ham social discipline chi ham khát bang le iki lam tàu điệu kỳ le a government in qua tỉnh suspend đi tu mà điệu cùng thủng bài tai ham mình khai transport department a program ông này vào le anh absent về cùng chín avec và suspend vào le office hem thì lâu dễ mà hỏi giờ các bạn government power và chia leu cho và suspend về khiam suspend tani na khol ho dismiss zo ma leu cho kwa ma lom non lo ti gari le register thei lo ti chidan de hoi zena tu ni na ingai to ngai he to vision lamka to be the best place in the world chi hi ali le chu e te ma bang le i azia tu hi doc medical line ke hello department dang ting le e sangam te khong ma hi un chin ni te khong I gang te khong ngen ma hi un chin office lama bang ma all ma lo hi da kal khata wa phak wale hi hoi ma ki sang en khong kha chu ko khang to di ma a scheme su mom ki le ke gen nop chu why department te subject kha ngai to ana piak thei tho tam takom de king ta ke ve tam ve tak Imphal level a I bangyam proposal thak ai kale project thak gen khom na hut bang le om thoi ve wai khong kha concrete de wai cha casual remark hilowa a hoi zo de gen khiak theina chance bang I hu chi bang ina e asem ten amuna om ten amun thei chang ten hun pele hi I thil hoi khatom dinga hi chi kha kamu da na hi a wai ja kina I doctor ki dai lo bang le ki gen chin primary health center rakha Indian public health standards ki chi India pumpia zat di Indian public health standards dana chu primary health center bang kha doctor ni kha hun ma koi we ve hilele e Manipur lamka ke hilo na Manipur rakha I huchi kha sep thei lo ja kwa primary health center rakha post thum bang li bang ki ko in chin thum khong li khong I koi zo lo chiang kha akwa pewin kha shortage of staff kha kile hek non ilele hitaka kha primary health center chi te kha government of India te pattern apai di le doctor ni omo le hut ma to chu ni koi le khatina nisom lenga sim de khat pe ni som lenga roster system khati cha informal apai MLA khatina khatwe sar na area doctor Leon koi ta ke vewa ka chi le kha ki pak lo di ka sakle no ni na koi chang wa khat 15 days thum na koi wale 10 days ha li na koi wale 1 week khat ma ki tang tho dion chin wale ki kun non ngeu zel ma ha wa je hai te khong kha I both the sides government le I thil tam taka ki systematic zo kia ki streamline zo kia hilele citizen lama pati chi hiam me kala society lama pat bang le ingai to na kha I kim le khiang in kwan pi te ta naw te in veng te sap tuam pi te khong ma ni posting mun le ngai to ngei ma lo chi te khong kha bang hiam khat akipat ngai hi chinwam ke ve ya fan lian piong om hen lan hoi cha project lian pi khathi de hoi chen lamka developer hi di chi kia pe nei ko ile kha i hunong sort kha thein chin wai te khong ngom the hut chianga i benefit lian tak mu thei de hi iki lep fel thak khat ngai ma hi chi kha ka gen no pa hia wana lam ka polam te ka chi anwaya WhatsApp University chi bangkon gela ya hi kwa na kai khau hiama WhatsApp University kha tu lai kha tam in chin ha lam ka branch bang leo min chin Delhi branch bang leo min chin international branch bang leo mai ve hai kha professor bang le tam ni dang lai underground te again dan de self style professor hi un chen amau kha topic teng hi le kup thei nei diu ma tu ni na kwa te hi na hi wa chi kha ge ni som ke hi le bang le a overload le kha phatuam khol loi ve ajiak chu no le tel na university na nei chi at dingwa agel tam khen khat ti kha a hi taka a thei lo danu ki sel pho lel bang le omui ve a student lam te kha tam zo kha ki polite thea ki counter gui khol ke ya hia ha wa ji hai bang le thil pepe wongom le kha i a critic ma a social tu ka pan ngai hi chi dan du professor Paul kha thil hoi sep som te bang le thada go du chinwam kai ve thil hoi ngai dan nei te bang le gen ngam hoi non ke le kilom mo a hi thei lo di dan thum khong han gen khe thei pa dingen kai che i asia to le lama kha hi kha i media mi chi dam forum valuable ma kha te ve man phama ma kha te ve i sum le sen ngai lo va print le ngai hi lo hi cha et mai thei hin chin hi le to a self style professor khen khatin dominate luat chianga kha i phatuam ta tak lo wai chianga i mi su thada mi progressive lo hi chi mai ni hoi je na hi bang le bang chi bang ina ipang khom hoi zo hiama to ka chi bai na aum dan kha group tom mong ki bol in china ki padan chu hoi pp hilele khathum khaguk khit cha kha koi group pe hile ki chin kon gen diap pathian thulam bang khat na hi loina pathian thulam all mo nan bol group khen kha tom mo WhatsApp to adang social political thil khen kha tom hon padan no kha focus de khat ne chon panu hile khathum khagu kong hi khit cha kha atel ten le cha kha why focus ta hi chi ngai to twan lowa why adang a post te ma kha group nga member hi wa le why te ma khon post non vek diu a khatin le why man post avek kha hong ki bang sim hi cha kha leave di here di here chi bang le buai hoi ha leave le lai contact nei sun khat i mi lak i lakwa i forum nei te i leave ze le koi tak tung di chi dan de ka la ka khai cha omin chen hoi je na tu ni na i pan khom naw to he i gen khom te bang le tu nin chu den jek che ki khen diwa i aban kha tampi ku kup dio ma hi na hi social media is adan bang le a hi hoi a sincere bangi mu le encourage dan bang government ka chi na hi tuan lo hi hai kha mi mal bang le tun vision lam ka ma bang le vision lam ka te pan lak na phat kha le ko ai om ma diwa ma tu ni na ki om khol loi mi phat haksa ki sa mo thank you le ki chi thei lo ei lam kha wa je na hi bang le ngai to tham kha to min ka theya next government ni ge na i huai tu lai ki lep dan en le to nin lampang to ki sai garbage bang hi hill district te to Lamka bang le paidan kha district council kha town committee chi oma town committee kha inverted commas in kon koya ajia chu town committee wachi tak de kha ekha rural area veki vewa Churachandpur district hi na hill district dang teng le I urban area omlo town ni chi kha chu urban entity gen na hin chin hoi ja ka hi town committee ki chi bang le town committee hi wachi wa phungwu ek de le sol kala de le hi thei lo khat wa je bang le bang chi hoi bullet anwai ka koi town committee ki chi didan ma urban area ki puan didan ma ngai to di hi chi bang hi ma bana vision Lamka bang in le hongtel kha heutulian le I subject expert tom te ni ngai to tham kha to min chin I government paida na government of India paida na hi le state government paida na hi ต่างเปีย rural areas อาเดียค่ะ development scheme ต่ำจอยจิน individual beneficiary ที่อาดิเลฮีไว้เจียง community ที่อาดิของเลดังค่ะ rural development scheme สตั้มจอกเสียค่ะ urban scheme สังอ่ะยัยภายจังลำของบังอะไร urban areas ฮีเลด expand ดีฮีจะค่ะไว้ละมาเลอุดคนละเววะบังเลhill district เด็กค่ะอันนั้นฮิเด็กตักเสกินจินฮิเลอุดโลทักงา rural สวกนอนเวกตัวก็ฮิตากับข้า town committee บางเลมินข้าดิกโลฮิตาไอเลบางจีอมดีหัวมข้าตัว village authority ตัวมเตบังเลอันนู้ตุง pressure ไอ้ทุกเย็นเตบังเลอาจจะข้าไม่เที่ยวดีว่าไอ้เตตุง pressure ว่าคุยปาดานินเลยไงตัวเคยเดฮิเลstructure ข้าบาง efficient เป็นดีงาอาจจะอยากจู urbanity ข้า feature ข้าต่างเปียpopulation ใครเจ้าต่ำอมคมเดียว density สั่งที่นี่กินไอจิกกับต่ำตักที่จะเตียงคมใส่ดิเลยห้องอมดานของตัวเองนีนบางเลยห้องต่ำดิตุย requirement บางเลยห้องต่ำดิ traffic บางห้องต่ำดิจะด้านเดียว features of an urban area ค่ะขัดตัวไม่เจียงอะค่ะอีลำก็ area บางค่ะหุจิดานะจู very much fulfilling the features of an urban area ฮิตาอีเลตัวเอง rural development scheme เลย urban development scheme ค่ะrural ลำตั้มจอกเสียกับurban area กิปวันดิบังเลตุนะวอดบังละกุยดิฮิเลกิอูดคอลโลดิฮิเลเลยไว้อูดคอลโลจะใครจะอาการละกะอาฟูโลขัดตอมินจินไว้ข้าฮิจินี่เลยก็จิตวันเกยเลยไว้ข้า point ขัดตอมินจินวันนั้นเหี้ยก้นเกณฑ์นบจุไว้เป็นทุกขัดฮิเลนินเข้าจินนักกิขอนาอภัยเกยมูดานะฮิตุนลำก็เอเรียเลเสียเวลบางเกณฑ์เดี๋ยวฮิเลvillage ไอ้ยัยบาซาร์เอเรียพวกลำเต็งฮีหอยทอยฮีจินวมเกยเวยัย south เดี๋ยวลำมีเกณฑ์เฮียแกเลยเฮีย east เล west ลำมีเกณฑ์เฮียมาข้อปีพวกลำเดี๋ยวปวดเลยฮีมาข้อส่งกี่ไว้ห้องดานเตเลยหอยไอ้ดีงะนินใครจะนัสลัวบางเฮียมอมนอนเราเดี๋ยวไอ้เวตานะvillage authority เตะหาปันนาเดีย youth club เตะของปันลางนาเลยเดียเลยดังเตะปันลางนาดีงะบวยรถเตลนอนเราเนี่ยค่ะเพราะฉะนั้นเลยเรามาให้ลุงเกียร์ง่ายเกียร์กิ improve ปันไตเวที่จะนีนอมลัวของค่ะมีปีนเลยเดี๋ยวด้านอมใต้จริง there are signs of improvement no there are signs of progress ไว้ค่ะอมมาใหม่กันเทียบวยปีอิไซเฟลนายโลหิเฮียตัวบาซาร์เอเรียที่มาเฮียอคบปีเดียกลักฮีฮิเดวมูเกยเวเคนเล็บเฮียเซมินาร์ที่อยากเลยฮิตวันโลว่าตัว tribal affairs บางเล็กก็ department เล็กขาก็อีเสียก็ตัว district council กิจีเตไว้หน่วยเตของข้าเกยเล็กขาเลยฮิตัวข้า district ดังเตเลยฮิล district เตเลยฮิเลยเฮียข้าบางจีฮิเฟลเลียจีหิมมาเลยกันยังไงตัวไอ้เสียกินข้าก็มูดานตัวเดนเองเฮีย garbage generator คนจะ waste generator อีจีเฮียมาเฮียขันเล็บเฟลดานขัดที่นี่กี่เล่ตัวลำก็เอเรียบางเล่นินพวกนั่นดิทรัคค่ะ district council เต้นบางจะเฮียมในยุนจิน staff เลยบางจะเฮียมในยุนจินเฮีย new bazaar บางเฮีย police station เกียงบางตั้มนั่นเดียกเดียวไว้จะมุนดังเข็นขัดที่เร่งกายลำเดียวของบางเล่garbage นินกี่ขอลตั้มนั่นเดียว spot ออกมาเวว่าขัดนี่ติงอ่ะคนทวีเววะอีเล็กสตาฟที่เกี่ยงอะไรก็เกณฑ์ด้านจูตัวไอ้หิด้านนะจูเด็กขึ้นดิน police station เกี่ยงค่ะอิมุจียดดินก็กิ่งอ่ะ police station เกียรเกี่ยงมาเฮียหอยมินค่ะอุตุดินไปเทีย dustbin กี่บอลมอกเฮียค่ะ Indian system อะไรดิกโลหิจินวมก็ไม่รู้จิตานะ develop country ก็หอเลยที่จะอ่ะเขาปีสูงว่ามุนขัดแต่จะเลียนปีนินไปโคมนั่นดิกี่บอลมลอยเว้ก็อีหมาอมลอยเว้เย่โตเกียวเกาหลีลำคงหัวเลี้ยมโลเย่เวสต์ลำมาไปเลี้ยมโลหุจีฮิโลวินจินะไซดันเอ็นค่ะไอ้เย่อินเดียนซิสเต็มมีมาดิกโลค่ะตัว police station กี่อันเขาจะเลี้ยนพิโอมินจินอ่ะบางเล็กิมจียงบางที่จะปูกตาเสียว่าเขาอุดเต็งอินว่าไปดิวว่าเขาบางจิตตุกเสียงอินะตัว district council อ่ะ in charge เต็นเขาว่าคนเขียฮิตาเลวเลย in the next 10 minutes เขาก็ให้มีน้องไปนอนเร็วค่ะไว้10 minutes คิดว่ามุขเตียนจุdistrict council เต็นเซมโลสิดีไว้เขาคนนอนฮิเลวเลยอันเน็กสักว่าย้ำขัดที่น้องไปข้าเกยนอนเห็นละเนี่ยนับไปคิดเกยว่ามุนอนเลยค่ะที่ตัวอาเซียนหุดโตมหลวงจินวมเกยเวว่าจะกับสตาฟที่เกี่ยงกับเกยนจุที่จะจุนหนุ่งเด่นในหิวจี นุ่งเดลเด่นไว้จะกับปันโคมด้านดังขัดต้มไงดิไว้จะกับตัวฮีกระส้มดานุจุเฮ้ยฟอร์มาเลยอีเมมเบอร์เต้นไงตัวดินหอยตะกมาเฮียเตคินาดินเฮียนิวบาซาระอีนูเตมาร์เก็ตที่เฮียบังอาไว้บังอาขัดอารมณ์ปีเดียวน่ะอมว่าน่าดังตังอมว่าไว้ดอร์กายขัดเวนดอร์ขัดินะบอมฮิจิเชียดิมเกนนี่ขัดินนินเกียอมเขวิโอจิหุจิเชียเปียกดิพลาสติกบินหอยพีอมไตเวกรีนรองของบลูรองของไว้ข้ามันนั่นก็อีดินจิน department ลำมาพัฒนา responsibility จูอัน next day จียงอินข้าจิงดากยาแต่ฮีกงคนดิหุตุเอเคลจิงดากกว่าฮีกงคนดิหุตุไว้เป็นจู department นี่นะ fulfill สามดิอิเลเลอุดเต็งนะไว้จะ open dustbin ขัดจะฟ้าไปอิเซลกว่าเตะไปอาจีเลเทโลอะไปเสียกว่าฟีลักเลฮิเทโลไว้เป็นนะครับจุดอีขวาข้าเสียงเอโลดิอะมินิเต็งอาเฟียงตูหลอมโลอีจังเอาไว้ใจนะตัวนี้นะคน propose นบจูอีไปอีมาบ้านไปดีด้านที่เต็นเชียงนะ district council town committee เต็นฮอน plan ตัวดีงัวถ้าขัดนะมุนเต็งอะไรฮิเทเกดีง่ายเฮ้ยครับ behavioral change บางลงอมดีเฮียฮิเลเลผู้จิดานในไปตัวเดนเกนเวียงตัวมเฮีย village level จุอีเฟลนัสันขัดเข้าไว้เฮียว่าจะจะมาเอาข้าพลาสติกเบกเฮียมันนักกยุนชินcollector เทวไปเจียงว่าเกตเกี่ยวงไปยุนหอยครับหอยแวนเฮียตรักเฮียมาก็เกยุนจะก็เกยุนก็เฮียมานินตัมปีมุเดียมนอนโลไวสไตล์เดียวไอ้ฮิเกเลอีลำกะเอเรียเฮียนีนองเปียนตัมนั่นเตะหุจิมาบังอะค่ะตัวเฮียไวดอร์กายบังเลยตั้มมาตอนจินเฮียเตลอยบังเลยอีดิสซิปลินเดียวไงดีไวบังเลยเสียนเท่านั้นเทเราไม่หิงคัดหิวนจินมั้งอีวางตาหนาจีเดียมาเมาค่ะอัดวันจอสังจอหน้าอมุหวยฮะสับที่หลักบังอมเลยจุยกำค่ะฮิจิโลเดียวจะกินตาเคยเวไวเตนินปอยสะเฮ็ดโลละกะหัวพัดได้จะขังตู้ขายหินน่ะเสียกบังอะไรอีจีขอมหินจินตัวกว่าไวหอมน่ะเสียก้าเลยเกณฑ์เกอีเฮียอีสูดเกได้เลยตั้มเดียวมั่วไวก็ว่าลำพังเตียงเตะบังเลยนี่ตาคมยาลเด็กบังลุงม่วงตะกะทิลจวกที่ของไปตู้มั่วก็อีตันกวนตู้สมไหลเดียมาขวามยาลเด็กเฮียตันจกิไปนอนเกเลยจิเลวเลยหอยดีมีหอยโลโซเซียนี่ฮิวเฮียมาว่าลำพังหลงไปอยู่มีอะไรเด็กหนุ่มของไปตู้ทอเฟงูลุงม่วงงูหมอกกิปะหวยละบังเฮหวยละบังฮิเลตัวเกนี่ท็อปิกเป็นไอ้เสียนทูน่าเทโลโลมีอีเสียกว่าเมาบังเลยเด่นจะช่วยเจนดาวของเตลุงไงดีให้ภาษาลักมาละโดดเฮามามอนจินนี่ฮิจิเจียนั่นเองเลยก็อินบอมนั่นเองนี่ฮิจิเจียนั่นเองเลยบอมนั่นเองดีไว้ก็กูดากเกียตองของดากสักอย่างคนที่เขาจะกูอิลุดที่จะหิดีให้เขาอีปังคมเลยหัวหน้า last point ดีนะตัวเฮียฮิจิเตะครับเฮีย sustainable development goals United Nations เตะมั้ง2030แต่น่ะ fulfill ดิสอมเลยสัก goals เขาเวลปุ่มปีกำเต็งไปเขามีนั่นน่ะกิตุกิมหนาวไม่เว poverty ลำทูบัง food ลำทูบังทิลตัวม point สอมเลยสักว่า clean water and sanitation บังเลยอมินจินมวยเตะละก็ค่ะอีเลยว่าจะก็ highlight นบจุอดังขัดอมค่ะว่า goal สอมเลยสักเตะละก็ค่ะresponsible consumption and production จีเลขาตัวไม่เวอาเจียกจูบัง developed countries เตียนก็กิมุดานุขะ house town จินวันขัดเลยนปวาเลตุเนี่ยขัดเลยดิวจิงจะเลยนอนน่ะดิเลซุมเนี่ยอันนอนจะเลยนั่นเนี่ยปวานักบังเลยเดฮิเลวนิดเต็งกิเข็นน่ะดิบังเลยเลยจะดิวฮิตาเขดับบังเลยอุตตะฮิเลวนิดเต็งทักเลยจะดิดานฮิตาหวยดานี่นะอามิปีเตียวอมหมกเลวค่ะว่าลุยจะเดียวเตะข้า garbage จงสวกได้เชียงอ่ะไปโคมนั่นดิมุนอมจะนอนเราดิว่าจะค่ะ United Nations เตนะ goal สอมเลยสักเตละก็ขัดตะก็อยู่ค่ะ responsible consumption and production บอลเต้นเลยบางที่บางวันจังบอลที่ไว้ลำเลย all หมดทำดีเลยอามิมัลอามิปีเต้นค่ะอีวันจัดด้านอีวันบังอีเดบังอีเล่ไว้ลำปังมาเลยอีก control เดียวกันเลยตัวนั้นนี่ดังไอ้จัดงี้เราอีบังเลยอี progress ที่เท่าอินเช่นอี garbage จะบ่อยหวยมาค่ะนาวงี้เตะ diaper จีบังมาหวยบังเลยอาจัดด้านเลยอาเก็บด้านคนนุ่งหิด้านเตะของ responsible behavior ขัดนี่เกลี่ยค่ะนินดังเตะสเลบ่อยหวยเวลาจู paper เฮียไม่แก่เลย food waste เตะค่ะจูหมวดเทนจินต้มจิกสุงค่ะอีเถ่งเข้มไหมเฮียเลยพลาสติกตกิสายกีบอลเตะค่ะอีจัดด้านบังจะอีจัง pilwang takin izang hia chi te khong bang le to apat ai ke educate ke le developed countries ten ni na all mo na sanu kha agamu khan ni na dimdek chi ana to khin veke vewa he lama Japan bangin le nin kha ong tamlo ma akoi khom cha dimzel huaite buai pi khina to mau kilem fel pan taw hin chin tu ni na ate le hia agenda I bangi chi da poimo tak relevant tak I lamka hi nop na dia I poimo ma kha vision lamka te non tel ke theiwa ki pa hoi ka sa ken le hia teng khong kon gen thea I summary chi dia ma conclusion point dan le kon bang kha thei tuan kia hi le gen di hi le chu to minimal responsibility e kha waste generator ki himo ke ve hoi kha bang chin a ken pan kala dia ka lom pa to bang chin pan kala dia kain kwan to bang chin pan kala diwa ken khaten a society a I position in le ken khaten department a position in le hoi kha ka ngai poimo a huana a hoi lam kha thile to responsible consumption lam le pani lag didan kha mi mal chiat ki ngai to thak le hu chin hi I ke hi genan khaten optimist ma ka hia I lam kalak bang le iet kwal chang in hi I progress na thil tam taka ma I mi le sa te bang leng namdang te bang len en ma hi wa point tam taka I hoi zen hi progress yel na di hi chi ka muanga mu chi na he teng kon gen dinga ki pa ke
Vice Chairman Vision Lamka Pu Colonel Retired Neihsial will do the honor of presenting the gift. Okay. Then moving on to the next, the last but not the least seminar is to be from Pu Dr. L. Fimate, former Director, RIMS Imphal and ZMC Falkawn. He'll be dwelling on roadmaps for sustainable sanitation system and services in Lamka town.
Good afternoon, everybody. V Vumlunmang, Haulianlal, and the resource persons, Neihsial, Chairman, Managing Committee, and friends. I'm really thankful for this opportunity to interact with you all today. But, a few days back I organized a cultural festival, a 3-day event. So for the last 3-4 months, I was fully engrossed in that. And I thought I may not be able to come today. And I have more or less decided not to present anything. But very often Neihsial used to encourage me and ring up. So yesterday I thought I will come as a delegate but not as a resource person. But in my second thought, okay, let me go and speak something. And whatever experience I have, I may share. And so I came. And we have had very nice presentations, my and other speakers, my speakers before me. I feel there is nothing much more to speak. Especially Pu Haulianlal has given a very vivid presentation of the issues, the problems, and the possible solutions. And so also V Vumlunmang, very experienced administrators, they have spoken. In fact, sometimes I feel I'm not qualified to speak on this issue of public health and sanitation, because my specialization is, a culprit to this public health and sanitation. Doing post-mortem on putrefied bodies, toxic matters, especially if there is no proper drainage to the morgue, it is a source of public health issues. So anyway, I would like to give some what is public health about and what is sanitation and what are some few things to speak. This what is yes, just to have an awareness what sanitation is a process of keeping places free from dirt, infection, disease, and waste, trash, and garbage. Disease can be spread from poor sanitation. Basic sanitation means having access facilities for safe disposal of human waste, as well as having the ability of, to maintain hygienic conditions through services such as garbage collection, industrial hazards. This is the main issue of today's seminar. And what is sanitation and what is the solution? What is to be discussed about? I think most of them have been spoken, and these are the 4 types of sanitation, just for our information. It's container-based sanitation, dry sanitation, community-led sanitation, ecological sanitations. So these are the what sanitation means. And hygiene and sanitation, we all know. I think these most of the educated people will be aware. This personal hygiene, food hygiene, and ensuring safe water at point of use, respiratory hygiene, safe disposal of this general hygiene. These are the things to looked into. These are the things which were not properly taken care of, and what is to be done for public health solutions. And challenges. Sanitation and hygiene are critical to health, survival, development, and many countries face challenges in providing adequate sanitation for their entire population, leaving people at risk for disease related to water sanitation. Well, these things, since most of these have been spoken, and these are the sanitation issues like toilet and latrines, sewer system, waste, water management, potential sanitation solutions during emergency response, and hygiene in low-income middle group. These are the issues in various places which we have to see. And hygiene and sanitation, and activities in sanitation, which we have heard from the previous speakers, maintenance of hygiene condition with a series of activities and programs to achieve it, cleaning to remove food debris, organic material and soil, sanitizing to reduce microbiological organisms to a safe level. Yes. Sanitations, toilets and latrines. They promote health because they allow people to dispose of their waste appropriately, preventing contamination of their environment and reducing risk to themselves and neighbors. Sanitation of a town, I think this is the experts will, yes, proper drainage system, we have heard in detail what are the problems and issues, and yes, incinerator is, I think we are very much aware of what is incinerator, especially with the coming of medical college. This is a part and parcel of disposal of hospital waste management, and this is, though it has got some disadvantages, but still Because of so many advantages, it is still in use very largely. This is how it reduced the hospital hazards to harmless material. Sewage treatment, well, let us not go into much details. What can be done? This is very important. These waste materials have to be collected and have to be dumped somewhere. And sometimes it is not easy to find a suitable place for dumping, and which even Imphal is having a lot of problem in a dumping ground. But and without dumping ground, it can be another health hazard. So also sewerage and awareness of the mass about hygiene and sanitation, toilet culture of the public, yes, awareness of the masses about hygiene and sanitation. Yes, what is hygiene? What is sanitation? Most of us know what it is, but awareness of hygiene and sanitation is still lacking. We know, but we do not practice. Very sadly, if you walk around in Imphal city, every street, every corner is a garbage. And it's very surprising. In Manipur, in spite of its civilized and advanced people, but still, Imphal remains a dumping ground. I used to question why. Manipur has got many educated people all over the world. There is I think there is not a single country where Manipur is, we're not there. But in those countries where they are, I believe, and I'm sure, they'll follow the sanitation and habits where they live. But when they come back, why can't they help their own city in improving the sanitation? I used to question. I used to write also sometimes. So this awareness is very lacking, which V Vumlunmang also has said. This awareness of everybody, the public, every citizen is what is important. It's not because we don't know, but we have not made it a habit, a culture in our own state. So also toilet culture of the public. Toilet culture is another important issue in the public health and sanitation. The toilet culture in Manipur is still yet to improve. You know, even in cities like Imphal, the toilet, most of the public toilets were not, fit to use, and they're not maintained, and they used to be very, very dirty. Even in offices, it is very difficult to enter the public toilets. So this toilet culture is another important issue. I was for a few years in Mizoram, and considering the toilet culture, comparing the toilet culture with Manipur and Mizoram, you can find a gulf of difference. In Mizoram, there were toilets at the roadsides, there were public toilets in the city, there were public toilets in the offices, but most of them were properly maintained. Even in the offices, the public toilet, the common toilet, is as clean as officers' personal toilets. So that amount of consciousness they have. And but here in our Manipur, this toilet culture is yet to be cultivated. And sometimes I feel that toilet culture is a measurement of civilization. Toilet is good and proper in any civilized societies. And in Mizoram, you go to the marketplace, almost every shops have their own nice, clean toilets. Even when you have a call while in shopping, you always have a safe place for toilet. But hardly in Imphal, even in Pauna Bazaar, Tangal Bazaar, while going there, if you have a call, urgent call, you may have to go to the gullies and open. And this is still there in most of the places. So this is, and I hope that doesn't occur in our Churchanpur town. So this is this public awareness is not the knowledge, but it is awareness that we must practice is what is important. And a good dustbin culture is another important issue. A place like Imphal, we hardly find dustbins in the roadsides. But I found in Mizoram, every corner there is dustbin. Even in the villages, they maintain dustbins. So therefore, cleanliness is maintained, and therefore a public health issue can be greatly solved. So dustbin culture is another thing which our Churchanpur also has to do. Regular water supply to all households. These are important issues. Well, I will cut short my speech because I think we should have more time for interaction. And what I would like to say is that it's not that we don't know, but we are not trying to apply what we know. And we should have this kind of interactions more often. And at least people who attended this program today can be, ambassadors of public health and sanitation issues for Churchanpur. We should be in agencies to spread the beauties of maintaining this kind of public health and toilets and cleanliness in our town. Let us make Churchanpur clean. And with these few words, I will say thank you for the time given to me. Thank you all.
Okay, thank you so much, sir. Sir, please kindly be on the dais, sir. Okay, thank you so much. Now it's time for open house discussion. I would like to request volunteers to place 6 chairs on the dais so that all the 4 resource persons and both the chairman as well as the vice chairman may also join the resource person. The delegates and participants may kindly feel free to discourse even in our own local dialect, because the town being a Pentecostal town, the language or the dialect in which we are comfortable with, we may use both the language all the esteemed resource persons may kindly be on the dais, joined by both our chairman and vice chairman, Vision Lamka. I'll be passing on the mic. Volunteers may come and leave the mic. Any question from the delegates or participants may be put to any one of the officers who are sitting on the dais. Do we have a third microphone, please? To be used by the participants. Okay. Again, we may use the third phone here, no? For. We may pass on the microphone to the public. Any. Okay.
You can raise your hand before you.
Now, I want to ask one question to our Fimate. He told that the toilet should be the one index for civilization, toilet status of cleanliness. So this to have the toilet system, to keep it very clean, it looks to be little easy, but implementation, it is, we feel very difficult. But from your point of view, how we have to ensure having this a very good toilet in the public areas and town and other areas you have experience in Mizoram. Thank you, sir.
Thank you very much, Dr. Boyaima. Yes, considering the stages of civilization, in not many decades ago, there used to be open defecation, and hardly many people have latrines. If you go to deeper villages, they don't have latrines, toilets. It is open. But with a little civilization, we started having, latrine. We dug the ground, and then not septic latrine. And then with a little bit of civilization, septic we started using. So these stages of civilization. And now it is not just latrine, it is very modernized latrine, where many systems, accessories inside the latrine. Now, it is very, the stages of the standard of latrine also indicates. So, a family which is not very much, standard, or if we say civilized, it may not be a very sweet word. So the standard of latrine, the standard of toilet in their homes, measure their standard. This is how people also write, and there are some houses, some buildings which doesn't have toilet attached to their rooms. They have to go out and construct another toilet near the house. And then subsequently some people have, many people feel that the necessity of toilet attached rooms. And similarly, in bazaars, market areas, now in most of the Thangal Bazaar side of shops, they have, most of them have toilets in their shops. But Thangal Bazaar site or this Pauna Bazaar site, you hardly find toilets in the shops. So that's why I'm feeling that the standard of toilet measures the standard of civilization or the standard of a person. That is what I actually mean. Thank you.
Okay, let us make our question very brief and the answer too.
Anybody else?
More
Let me. Yeah. Though I'm a member of the village, Vision Lamka, let me ask some questions for the benefit of the participants as well. Number one, I will ask 3 questions to the 3 speakers, the 4 of them. And to cut short, I think after my question, maybe they will try to find the solutions one by one, replies. First is with Dr. Pau. Presentation was excellent. The activities they have done in the district, in the medical department, is really hats off to them, especially during the pandemic. Now my only concern in this total experience and activities that you have taken, in the second slide, the dashboard, let me see, this is the dashboard, the performance of Suanmung town in comparison to Manipur as a whole and the national level appears to be rather not encouraging. In that scenario of that yardsticks that you have given, do the district level or the government of Manipur have a certain action plan, or in the district level, do you have that time or a way forward to achieve this national figure or improve the performance of the town better than the overall state performance urban city or town requires? And most of them, especially, what I come to know is a holistic approach, no doubt, yes. Because in the smart city concept also, sanitation and healthcare is one of the basic items. Now, coming to that, the requirement, as you have already explained and put across to us, is very clear that we need a total holistic approach. Suppose in terms of food habits, or the hotels that is running around in the town without any proper or what we call certifications, whatever. Now, what I find is the conclusion would be, my conclusion should be, we need a standardization. A standardization in terms of restaurants, in terms of traffic, a standardization in terms of toilet construction or building construction. Some kind of standardization has to be proposed for the town, in that whether as a district in charge in administration, can the district administration intervene in such a way that this type of a plan, a policy, standard policy specific to Suanmung per se is required and can be done from all level? Will it not serve a better and earlier or urgent purpose in solving these issues? So let me end up these 2 questions. Others are, I think it is a subsidiary of to this. Thank you very much. Thank you very much.
Thank you for the questions. Epan kondong mai dinga. Khanna kha maternal date kha e chu Suanmung district ka chu to ma ta ni danga kha naw ne ja ka si bang tam tam thein chin human crime na sa the lo to kha chu khata si leng kha asa te na bang ja ka si wai naw mai kha. Is it within a period of pregnancy, means fertile period ai lo ka chu kum som dile kwa noi lamai pe ma le kha maternal date ki pomin kum som nga tunglam te kha chu naw nei the non lo e chang kha wai te kha chu woman date I main asa ten jong kheu azon kheu no man le ki pian u cha ki report chet in mo oi ja ka kha woman date e cham maternal date kha to ma tom tain chin chu Suanmung district ki pa wai ma naw ne si de wang ma asiom na chu ki serious mai che ya himal. On the other hand, neonatal date kha tam thei loin chin aja kha zenims de rims ten hoi ta report lo ka thei ke wai ten kha chu delivery kha 1000 per month chu ko kha district hospital kha 200 average 200 per month in chin wai le neonatal de kha tam thei lo aja kha wai ja ka government of Manipur in kha SNC EU sick newborn child unit kichi on put here on chin delivery point na kha nakla hiam bang hiam om le kha kina wai kha sip ding in wai zone leng kha monitor ki ko in chin it leng wai te leng phatom zo tak lawin wai chang sepsi song tam lo outbound ichi chang kha mundang apiang a serious jong ki polu rong tam lo chang kha mo the home delivery tambe ai ke le koi private hospital ki deliver te kha ong tam lo cha kha neonatal death means death below 1 month or 1 year neonatal ke 1 month in infantile death ke 1 year below mo wai te khong sangin wai jaga kha Suanmung district in chu ahi bang ha ita ki piak jaga kha death rate sang khaung idi adang ten kha ta pe khalon sin wai ja ma niamin so Manipur is a good place to be born chira nong pai do khai be ya choi ta ka statistic wai ta ki piain wai chang DC level a le review ki bol lai maternal death review wai ta ki bolin wai cha DC level a leng ki bol zel a dead party te bang ki samin chin wai ta bang ja khiam chi wai ta ki sui de tina hos dana na ki pai chu to chu hi adena kha latrine to ke sanin kha chi kon be rap dinga Suanmung district kha ODF open defecation free district hi chi kha akipon na sopta ki pawai mama open defecation of non lo wana septic latrine kha i thei chal sa bangina latrine kha sabon jat phar lo ai chu sabon na jatu re kha waya bacteria ten kha wai ek te anane tuin atu luang dok in chin bacteria kha sive kin chin septic sunghim hi ma kha sabon jat phar lo chi kha na gen chal le oi di
Tua donna ni to ke sai pena kha none ya DC ka hi laina dustbin thu kon gen ma sa sodi nga CRPC 133 ek noya zangina dustbin nei lote shop te kha close de chi wai order ka pass ta ho china dustbin ki chi kha nei hak lo izya kena le man tam lo izya ken none ya dorom te ten chu chen dustbin nei swa kwa wai kha DC la ma pat hi thei ding ai dinga in hilale halaga district council ma izya kena direct kena implement hediam chi chu ka thei cha kia DC na in wai kha to cleanliness nam to ke sai hele hu chilo food safety standards pen chu government of India FSSI ek noya kha wai food safety standards om sa hiya wai bana district level tinga kha food safety officer om vekin chen wai tena hoi taka anaw hi thi na dia kha DC level international CM all level khate health level ai tale kha hu chidana hoi taka monitor hile chu wai dor te kha magisterial power sanga FSC AI certification honi ki wale kha close the ya ma lewa executive power pen kha thu tuam hile public awareness kha omle kha hoi hoi phot dinga ya hi chidan penalizing provision te kha direct ka vasat sanga kha mi pi ma main amao lama pat awareness hon pai a hu chia amao ma hon ki volunteer wa why standards tan anei thi na diwa dor hon bol wa hu chena hi leo kha kwama a dor te leng athwa kha lengam di loading government in leng kha penalties tuam te impose ngai loading ma hu chidana kha awareness kha nom theidin ka ging ta why zakai chidan forum tuam te khong pai mo na le why ma hiya shops tuam te why ten hoi tingna awareness nei leo chu why FSSCI standards tan kha cleanliness standard a himaya wale quality control na to ke sai ya wai ta khatun hak din ka ging takia le awareness nei pan tai wa hoi takina awareness nei to zo le hu chi zo nanga wai standard zui thi lo te yo ma le chu he penalizing provisions te chu zat ding mai CRPC noya kha magisterial powers anga kha dor te shut down the pa ke
Hello, my respect and regards to all the resource persons and the participants today. My name is Briz Kim and I'm one of the members from Amsungi Youth Club representing our village. I actually have around 3 questions, and let me make it short. The first one is, globally there are more than 4.2 billion people who are unaware of safely managed sanitation. And I would like to ask the Vision Lamka committee members if there's any data about our town, about the people being aware or unaware. That's the first question. And the second one is, there are 80% of the population globally are 80% of the wastewater always go back to the ecosystems which are untreated and unused, reused as well. So in regards to our town water, how is our water bodies doing? Are they really healthy as well for the common people? The third, I would like to particularly ask Sir Haulianlal, just before you talk about the limitation of public urinals and toilets, actually I should say there are some of these places public urinal as well, but the problem is they are not properly maintained. After some months or sometimes they will turn into garbage bin or dumping area. So sir, what do you think should be the measure to be given, or how should we take care of all these public properties? Thank you.
Let me answer briefly. Thank you for the query. In fact, Vision Lamka has not been able to do it. We would like to do it, to have the authentic statistics of this town in various aspects of it. Probably the district administration has certain statistics which I myself is not aware, but I believe there is. And how authentic they are, we are not aware. Vision Lamka actually announced in the first session itself, and still it is valid today. If any student of college, university has done any research on relating to Lamka and has obtained a degree in that aspect, let it be population aspect, let it be sanitation, let it be anything about relating to this town, and if he or she gets a degree certificate or certificate, Vision Lamka would like to acknowledge that student by giving an appreciation of 10,000 rupees. That still stands today. Because as of today, we are still talking in the dark. We don't know what is our situation. Number 2, as regards to the that water recycling system, how the actually the dirty wastewater actually is getting recycled into the system, water table, I believe that is correct. I'm not a scientist, I'm not a technical person, but one thing we must remember, we need to save our rivers and streams in the town area. If we don't do that, number 1, all the wells that we are digging within our premises and compound, because of the poor supply of water, are going to get affected, either by contamination or by actually drying up the entire wells that we have. This kind of public awareness has to be spread it out. And I believe the CSOs, the village authorities, even the churches can play an important role, and we are ready to take up these issues along with them. Did I answer all the questions? Anything left out? Okay. You would like to supplement?
I'd like to just add a point what our chairman has said. Beside that 10,000 rupees, Vision Lamka also promised to give 1 lakh rupees to the cleanest locality in Ccpur. That's a standing instruction. And so far, none of the localities are clean enough to get that award. So it's a challenge, and I put forward this challenge again. So 2022 passed without giving away this award. So I'm sure that 2023 will be a better year. And I'd like to request everyone here, especially the village authority members and all the participants, that if you all can, encourage your people, village folks to get your locality, then we promise somehow rupees 1 lakh. That's one. The number two is, you are from Songel village, no? Yes, yeah, great. So Songel, I must appreciate the village chief happens to be my childhood friend, and he's doing a very good job about your drinking water problem. He has personally contributed money apart from contribution from the villagers, and they have laid a pipe through their own effort for clean drinking water. Now, you know, Suanmung is a very complex place. Like, I come from headquarter Vang, where the water tables are very, very low. So if you dig a well, a tube well or something, you hardly get water. Now, if you come down to the other side, like if you go to Marweng or, you know, these places there, Renkai side, the water tables are quite high. You know, you get water. But this Marweng area and all, you get that reddish water, red oxide type of thing, which is not healthy at all again. So it's uneven, and I wish somebody really carries out a study on this particular subject, because we are still unclear. And it's a good thing that you pointed out, because I think this is a challenge for Vision Lamka also to get facts and figures straight, so that we can actually feed the administration regarding how to resolve this problem. Thank you.
I'll just answer the third question about the toilet. Community toilet, there's a very easy solution to it if we are really intent on it. You just have to make it a paid toilet system. Okay. The free market capitalist society works precisely because, it's successful precisely because it works. In order to make it work, we need to make it paid. Those who cannot afford will find other ways to defecate elsewhere. But those toilets, in order to maintain it, you have to give it to some private party or to some NGO, responsible NGO, make them run it and let them charge whatever amount they want for it. Maybe 5 rupees for urination, 10 rupees for defecation or something. But unless you introduce a paid toilet system, no matter how good infrastructure is, it's not going to work in the long run, right? And secondly, also about the lighting system in the toilets, you can use solar lights. At the time of the infrastructure construction, if you use solar lights, you don't have to maintain it. At least you don't have to supply the power, and that will be able to handle. And the rest of it, supplying water to the toilet regularly, making sure the toilet is clean, all these responsibilities will be given to that private party. They would have to handle it, and either the district council or the village authority, as the case may be, they have to regulate it and monitor it properly and ensure that they abide by the deals of the terms of the agreement. So just make the toilet paid, that way it'll work. If anyone wants to add.
With the permission of the conductor, in fact, I don't want this meeting to end with just good intentions. So I will take the sort of risk of declaring, and in between I will request Jolene, please come up. She is there. Come. We have to stand in front and declare it. She is Chief Executive Officer of our Autonomous District Council. And we have been discussing which of the garbage areas we can clean up. As I mentioned when I spoke, police station, just next to it there is one. Then there is another one, New Bazaar side, within the New Market. Nute Bazaar. We are reducing it little bit. There are many dirty spots there. We are talking of garbage dirty, not the other things. So what I would like to, in some ways, declare an intention that the district council and the tribal affairs and hills department, we will consult the area MLA. We have an elected MLA. We will also consult the village authorities who happen to be in that jurisdiction, and the Deputy Commissioner Churachandpur will very much be involved. We want to clean up that area, the garbage. And the procedure in which it is done right now, I feel it will never be clean. There is lack of accountability of the waste generators. I feel they are not even aware that they have a responsibility about the cleanliness side. That if they have waste, they just go and throw somewhere. So we are taking a risk, but I will request Jolene to say a few words, and as we move forward, things can become a bit rough also. Some will complain, some will criticize, some will try to find fault to the department to avoid their responsibility. Many things will happen, so we will have to work together. But I think as Lamka, the way it is dirty right now, when outsiders visit, they will call it, I don't know what, either they will call it a slum or they will call it a inhuman kind of this thing. So we have to tackle it. So let her say something, and this is something, let's do it together. Whatever you want to say on that point.
Since my SCS has asked me, I have to stand in front of you. First of all, before I said anything on the topic, I'd like to make one clarification. Sir Haulianlal was talking about paid toilet system, and then I'd like to inform everyone involved that recently Honorable MLA Churachandpur inaugurated 3 smart eco-electronic toilets, which will be a paid toilet. 2 are in Nute Bazaar, 1 is in bus parking, and the 3rd one is in near police station. So if you go and see, you would be, you might be impressed as well, because I think it will be maybe one of the first of its kind in Manipur. And definitely it is in Autonomous District Council. It is self-cleaning, and then we have a biodigester, and then a proper water supply system. So I'd request all the ST members. Suanmung was there. He was there when the inauguration happened that day. So he might also be able to tell you. And then with regards to waste management, and my SCS has been continuously, encouraging us, pushing us, and personally, I'm also very interested in waste management. So with the little fund that we have been trying to, do all sorts of things for our district. And then with regards to that, we have already installed plastic recycling machine at second dumping site, and also incinerator, though the capacity has to be increased. And like Fimate has said, incinerator has, its pros and cons, but the pros outweighs the cons, so we are still using it. And if in the future we are able to procure some more machines, we are thinking of procuring trommel machines for treating legacy waste as well as the current waste. But if I keep on talking about what we desire to do, unless there is something to do, it is of no use. So our current focus, and which my SCS has been pushing, is regarding this cleanliness in Nute Bazaar. So recently we have installed 3 dustbins outside Nute Bazaar, and we were thinking of giving dustbins to all the vendors, but considering the area and the congestion, we dropped that idea. What we are planning to do is they will be depositing there in the dustbin, and then our garbage collectors, council vehicles, they will collect the garbage. This, especially the council vehicles, they have been collecting garbage like twice a day, morning, evening, along Tedim Road. But like Sir said, after you collect it in the morning, 5 minutes after that, somebody else will dump the garbage. So that waste generator, the responsibility of waste generator is of utmost importance, and we must all know that we are all waste generators. So let us all take the responsibility And it has been a challenge because, for example, if we keep dustbins outside, 2-3 years before, council put dustbin along Tedem Road, all along Tedem Road, but now none of the dustbins are there because they're either stolen, they're broken, or, those kind of things are there. So that part also, maybe village authorities, philanthropic organizations, CSOs, and even Vision Lamka, we should encourage each other, because for us, the law doesn't work, really it doesn't work. Because if we try to do something, if we try to streamline the bazaar area, they'll say, think Nuimi, think Tungmi, so many things, vectors come into play. So what I have learned over the past 3 years as being in the council is that we have to somehow find ways to take along people, motivate people, and they have to feel that ownership. Bazaar area belongs to me and not to anybody else. So it is my responsibility to clean. And then not only Vision Lamka and CSOs, I think even the church, they will have a big role to play, because if we make that an integral part of our, system, our lives, the church, the CSOs, the administration, council administration, district administration, and, Vision Lamka, and also NGOs, I think over a period of time we'll be able to do it, because our mentality is such. If somebody asks us to do something, we just don't want to do it, anything. But if somebody, if we are convinced, then on the other hand, I think that also shows our tribal nature. Once we are convinced about anything, then we are ready to do it. That convincing part, I think all of us have to take an active part in it. And then, so today I'd like to use this platform to request all village authorities, some village authorities, they're very good. They make it an integral part of village administration, this cleaning, sanitation activities. So maybe we should be the chiefs. We can also definitely come up, have awareness programs. We can collaborate with Vision Lamka. We have no problems with that. So, anything that will maybe change the mind of people that, we go outside our state. If the city is clean, we always take our garbage and throw in the dustbin. But as soon as we come back to our district, to our state, it's like a normal practice. Whenever we are moving in a vehicle, if we eat something, we'll just throw it on the way. That anything to change that culture and that mindset, I think it will be greatly appreciated. And then our SES is here. So any initiative from the public that would, bring us closer to our goals is always welcome, and it is always appreciated, and it is always sought. Thank you very much.
Yeah, mi tamzo non thei mai thei kwa ke pakhum ka hia non thei dewa ken suggestion ka bol u thei le tunina heutu te na om chia twa lamka de na waste management to kisai akigena hoi to kisai na le new lamka kachi new bazaar area kha lamka de center point ai jakena apoimo ma waila kha suksia na de mo hoi ding ina de na heutu ten thu tuam tom nong genwa ka suggestion u dai le banga ADC lamina leng banga hiai ami a personal mo a duty di a permanent na omke le kha waila ka waste management ka ki maintain thei ro ding aya hoi jakena a duty di a personal waila ka ni khata 8 hours chi 24 hours chi mo wairan ki om thei le wai an nin pai te kha hung bei pan chau ding kamwa wai pen kha ka suggestion no ma hia wai kha to heudu te ADC lam hina makai te na le hi program te alo china de action plan pen kha poimo ka sazo ken chu gen sang ina banga accept khiak ti tak dan a problem identifier wai pen solve pen kha poimo ka sakja ka wai solve na de wai poimo man mai chi kha kon gen wa mai ka ki pa ka
Moderator, resource persons, distinguished dignitaries, ei pawin hin saying kating pakum sanga hung ding masa ke na ma election tet ngam jap ta kan ot ai en ki tet ngam lo hen ken ka sei nom khat na che hele DC Pherzawl le DC Suanmung hi ke upi a NREGS Nerega scheme hi che Swasth Bharat promotion ha bol thei dan lampi dem aji chu particularly to the Lamka town to dum be se alo lampia ke kai mai ni khuthamu we it's all hi thien thona langa single use plastic cleaning langa hin concentrate han nang le government program nang hi thoding mi pi in promote ki bol le phatchum na amdem ti chu ka point khat nai hin ani a chun chutia government policy program a chu ke lu theding a hele every localities to install incinerator. Incinerator he once I contacted Manipur Science and Technology Council ecology wing kagahopi welcome abol povin amohon hoi ta idea tam pp policy tam ps7 ahoya hoi the aya zuken amoho policy sai zu tu ni a gungal kai na thein kamuye survival means chu plastic chu hal aham ai lo le disposable te nga hi ja chu village ahin incinerator man lang locality man lang hele ka sei lo na ji chu it was 2021 Republic Day gen chat le hela chu the Battle India te platform me pa he ka khumin sahian jang hi hung figure up chu I was wonder ya chu cha te ho ja Better India te website to check la check la ken ka ga la kamu bang la just 8-9 years village to Indian villages forwarding kitila so aga jaw the na so dang hai pon the struggle for single use plastic thei top jo ka so we aya so thil bai chu helo hi chi a jo ka ki jaw pha hi mai thei ding ka ging cha tu chana struggle ka bol we ala chu 113 battalion BSF for incinerator in ball piole they why pen to hilo I as a plastic to tui lo sa jong la vadung nen kit ding le ai pai jong la thang kit de as a hu chu welcome hi yong incinerator hal mai chu tu tu ading as solution kha dei tia chu ka gel hi number 3 ak say nom chele involvement of the church ho bung ho hin tu nia ho bung ho ka dem yong ai pu in ai lo le in other sense aga se yong ai pu in thien hin kho sei tam pen ho bung platform hin ho bung a church a thien hin kho ki sei tam na chu no smoking no tobacco here chu hi chi church in jong a chi pi jing thien hin kho chu enhancement locality thien na yong hi church in pan la han lang hele a hoi be che dem number 4 aga sei nom ki chwe hele involvement of the philanthropic organizations. Philanthropic organization ho involved one lang, church involved one lang, MG Nerega involved one lang, ama youth club ama philanthropic organization community set up area chun checking hoitan ki bol han lang hele. Lamka hi ei loi chu thil khat he na le ki practice pai namaki in. Coming monsoon hi change something to get expect ma kai chu. Tichu ke kalung gel khat kaga sei do hin ya chu to a khopi anien ni ti ho he wanoi sim ti la pana pathin in plastic to sim thai nai sai lo he en ga kisuni nei issue net lo le thing mai ding hin it's very easy simple ta kha dei ya chu hi chi athin na ding a chu su net lo ding su thing ding ai mai jing hutian lang hele pan la the chu le clean Lamka hi na dinga hi chutti lom ma yong area to expandable la sumlu dinga hi tu a hi chi waste management a dinga hi a zong pen ni nong bolte a hau pen ni nong bolte al sap pen nong bolte a so pen ni nong bolte even guch hon nong bolte so lung tu ba le ite ta bolte thil khadai ja chu chi chu idea share kan bol hi ka gi pa
I saw Pu Kapal, I thought he was not there. You have anything to say? Short and cryptic.
Minit nga sok yan dike. Kami na hilakap lin la lahi. Solid Waste Management Professional Agency khat 2021 kan ko kapana mo. Govt kan nei kha churachan pulam ka clean te support ngin kong ki pana. Ka theichan chanin tua ADC CEO nu tale kala ki muzingo kala ki ho tu zingo tuni hin dana lagen zo siu khale a ho ibeka pu haulen na gen STP tivel mo FSTP tivel ho khale kala gen khak sa hi CEO nu kingin abang pen tak chele tuni ka gen ni tam kala zik tha hi gen seng ta lo ding ka hi zekin churachan pura dinga strategy vision kala nei ken proposal kala draft khat oma mo echo tuni hin pu ACS pu Vumlunmang le honga CEO nu keng khat bela submit ding ka hi ka theilai se lamka clean lamka tin pen hi ke ka wa ki phanai putala ten professional la kira khoina me mi ke hi garbage men kai ki te mo eka chun ke free service churachan pule lam ka chunga ding hin ken le ka thei top so ka skill nei te ka knowledge nei ke expertise nei te zo se churachan pur suk theng ding hi serious contender khata kum khat kum ni sunga chen sung pon tin mo dan khat I hepe ko ilung thimu chen sung pai lo ding hi apoi mo pen ka sak tu chunga nili ninga hem nu te bazar ka boi piwo ko ka bathil mu do cho hi le pani cha chom chan hong gen ka tin mo ei lamte ilung thimu achapo thei ta lu chapo win mo kaule sep kanen kaule sep thang ka inai ka gamai ti mayun mo kaule hal ding ke gamai chula ti mai awareness mo hong mong umlok ka gam sungai ka thu bowling ka ti wo I kha mindset na ding hin na sataka BCC behavior change communication pat ngain tin jibana chun ka suggestion CEO nu keng kapenai post ai extreme panio mo can to shut down Churachandpur for 2 days shut down Churachandpur for 2 days more and ask all the shopkeeper to clean the drainage more ikha CSO hitang lang district lam hita henang pale church lam do sen dukan do se shut down mo na la khon nam selele mukana thek pi mai ding bazar mong umsak lo mo je pata khan strict takin ki maintain henang kipan something change sangom diot hi ka ngai dan he extreme dewa ka bangkar ka suggestion he applicable thelo hello mai thei mo eka chun ahin la kaung genut pen solid waste management na dinga chun keile I tu le tu da tin Churachan pura dinga mo ama sapen ka hi ka factory lam hen kaung set up a Churachan pura dinga chu akiman sa jing ka hi ti kaung genu ri ka kipa ke
Kamin zu thaga ton singa BJP Vice President kai senior most kai Dr. Pu Vumchinpau na Hondong le ka chia hi ka question number 1 ajiak chu ma hun la ya Churachandpur district hospital a toilet chengsom pe ka kilut ki thai jiakin Sunday ni district hospital a function a hima le toilet hi akikha ka biakin kaiwa hi leleng akai lo te hong sak leu ko nature ko ni khata thumvei live lute ki gimlo tel ka hiu waja chief medical officer kanonil sak theidiam chi number 1 ani na ding na ya ex MDC chairman populang kan pawin saka lan valu ya kha nin teng akipaya zan ma man kamoi waja kina Pu Vumlunmangin IDC itaku instruction pi na DC makai na aviate to ona sak theidiam instruction pi sak theidiam number 2 a question tumna dingina tu lai takina ko paite area Niulam kai ui culture uivul wai kha athangina thanga Teirol college student te sangina numei Teirol ten dei zo kid na lai se dei awai ziakina hiai hi viete kianga Pu Vumlunmangina ui hi kholak wak lo ding kholakala ek ta sak lo ding khi ding chi aru loi takina mia peleleng langa fai ni chi IDC nu zasinta zarata ya banga zasinta ด้วยอมและออเดอร์สัวของอันนี้ทักเกนลามhills กับปูลุนมังพวกไอ้น่ะตัวกิไซน่ะเวียอามาพวกไอ้น่ะตัวกิไซน่ะขัดเวบังไอ้เกณฑ์นี่เวทุมเวแคมเปญของในปีเล่ยายดิ้งอินะก็คนเจียรู้เอลันก็คอยสนฮีเฮติงก็กินนี่ก็กิปัก
เกี่ยกับเมนเลี้ยงจะทางไงเตะก็เฮียquestion ขัดquestion นี้ก็ต้องนอมา number one ก็ question นี้ต่างเปียนุไม่หนาวในหนูปีเต้นอาเกนุตั้มตักกิจาฮีหนาวอันนี้เด็กเจียงว่าซิเซเรียนง่ายอันนี้มาสัตว์ข้านอนมารับเปียอันนี้นอนเด็กเจียงว่าอ่านโอเปอเรชั่นง่ายบางเสียก็เฮียยายก็ไม่เน้นเขาจะว่า policy family planning ตุกเสีย again ที่อากูก็มีไอ้เกดดาตัวเต้น operation กี่บ่เลยสมมุตินาดีลำปีอมขัดอะไรตัวเฮียยายกี่กาลฮะเกณฑ์จังเดี๋ยวขัดอมเดตุมีปีอาเดียไงดันทว่านับขัดอมดีมั้งยายปูอินฟิมาเตลมาปูเจนปอลมาspecial amount subject ไอ้ number one number two นะที่ไปมุกรถกิใส่ก็ฟิจารณ์ก็เตะก็กระโดดนับจูวัวอาจุกจะลำปีลายหกตัวนั่นสัตว์ที่น่าหลวงเสกไว้นาลาหลังนี้ตัวก็กี่บอลเตะอาลูนาดีนาลาลูนาตัวฟังผมโลไว้ลำปีลายหกตัวหลวงอินเขาจะอาลูอันล้วนเลยลำปีเลยสุดเสียปาดีมั้งเขาจะเลยวิจารณ์ก็เตะนั่นมุขังอยู่เฮียเฮียตัวกิใส่นะอาคนสันดิปาร์ตเมนต์แต่ละไอเดียน่ะว่าสุนเงี้ยเฮียไว้ลำปีลายตัวหลวงค่ะอันนาลาลูนาดีนะโฮลมึงบังเสียมาอาพอยมันมุนนะมั้งกี่บอลเลยตัวลำปีตัวหลวงโลดีนาลาลูเดียลำปีดรายดีสิไอ้ยาไว้ปล่อยมั่วมาก็เทียกันนะวิจารณ์ลำก็เตียนไว้บางไอเดียอันนั้นเนี่ยขานะตาเนี่ยว่าไอ้เกลี่ยอันนั้นเนี่ยขนาดเราเนี่ยเฮีย thank you
ตัว cesarean section ทวงกี่เกณฑ์ this matter regarding cesarean section in fact in the latest National Family Health Survey 5 National Family Health Survey ครับอินเดียปุ่มเปียกิฮิโตเซลหินจินตัว latest ของ port kia ค่ะ National Family Health Survey 5 ว่าครับall India ดานเลย all India data เลย the percentage of cesarean sections are rising ว่าค่อนมุขยาวจินตัวเฮตุปานนเกณฑ์ลำก็เอเรียเล็กขัง all India เล็กขังเฮค่ะ this is one of the public health concerns which have come up expert review the expert analysis da nakha ahi chi khan to di hilo medically etakha cesarean section prescribed na di chiam cesarean section unavoidable kha percentage 5 yam 6 yam 10 tanai tak le hwai tan le hilo di 4-5% khong chu complication om naw ngek anu sunga omdan alungat dan ikya le tuam zia ka chu compulsory chu om hilele hwai ba na pai to om hi chi kha National Family Health Survey 5 in kha hon mukhya in chin a district sang ale Thobal district kha a percentage dana 48% cesarean section na hiwe over the last few months and years sang lo mama au chi le investigation dan de phia la kha ki pain bangi cheria of a lower staff can khat bang ki transfer khia a hwai mu na khai cha nexus chi dan de wana omu to latest kha a hwai mu na gynecologist om pen le ki transfer khia so ye hi dena non gen tup dan dewa nexus khat bang le om se keive I ko ko yamin kha phatwam pi na mo hoi ja ka gen dan khatin gen leng dena kon gen te kha general simai mai the de I doctor te I nurse te ko pe sincere nga hi ka chi na kha attendance kya sincere hi loive apoi mo lo pi cesarean section prescribe cesarean section on prescribe chiang kha asen neng le hong tamin chena lo thei lo wa kha benefit bang le om hoi cha doctor ma ani duty namun government hospital om den lo alanga tai u tai chiang wa tu hutina dak thumina hi de dak thum le kim che hel ma ka wa tai non dia wai bang along ki zom ve ke ja ka kha it is both yes regulatory departmental in le tackle ngai all India tanale it is an issue which has been raised hilele social tak bang ale ki ngai to athak ngai ve a doctor an hi kha tu ten kha hoi lampang kha phaje sai pai zel le kha I adik lo kha to min chen hoi ja ka social level ale apoi mo lo ta na ki prescribe procedure chi te khong kha I hoi azil lai wa hippocratic oath chi khong an lak tiu doctor te bain le sim tha ku hen lan sim tha ku hen lan wai bang le thu hoi ma mo hoi commitment te bang en thak leo to den lamong ki gen dan de wa kha through rules and regulations and laws ali pai ngai social control ali pai ngai individual sincerity ali pai ngai church bang in le role in ngai I problem kha tong piang pa nei non ta ve he cesarean section kha Lamka le Manipur le state dang ale I think kon gen di
Hausalam male ji ka chairman pau Lamka TD block ka pu thang Suanmung ahia ke secretary Mangkholin Hill Town Hausalam male dot na vak lom katia kong dot go de ya abangile new bazar thu na gen pha tu le house thu na gen pha tu le ke man thim hiu ho wa nin lambang na gen nu le lak khat chum lo dingin ka ki koi khot me ya new bazar aum ka hi je gen abangile I vak dot lo thei lo a hi je ken neu khat ji sanitation chung changa ken le I panha la kin kan la tho ta a je chu hill town ki ti new bazar area lakho control hak sa khop main a je chu laka khu I partner NGO da ni khun garbage collection khu ke won ka bolun hilele I bol thei cheng I bol zo nunga garbage collection abol lo namuna ten ahung pai tho se ko hia Japan hi pu khuma house elin le ahead ma ka ging cha mun chom choma le hong paisa ka hiwa Japan hi dana khana gen ta duty hi kuman ki pujing thelo village authority ni pog le da ko dak som chani wak po akal khat kal ni wak pog le ki pe ta lo ti thein ji hi district administration lamten pan lak the na dem ti hi dot na khat na yan lan ni na kawak do to chu hi le Tilkhat kalung thima no document residential certificate domicile ho bang iwak la kut phat le chom khat kha initiative kanala vengsunga solid waste management card nei lo te khan residential certificate ke kenga lak thei loading hi ti khan initiative khat kanala je pen hi vengchenga hi theile panla na khat leong hin ten ji chu a hi thei dem hi thei po dem ti chu nget na khat kan bol hian lan khutile ji chu nei lo te chu venga recognition mo lo bangma hi thei lo ngi main tin ji chu knowing hotelam ten ina ngai tu sakdim kong nget na ka bola ni na dana khan pu Vumlunmang in la khan a PPT khan ka vaket le hierarchy dan de winong sima district administration ong sima anoya ADC te MDC te ong sima anoya house te ong sima thili bol cheng hile khoila kho hitale bizang hin saklam hin thanglam hin khoilam hitale neu khat nin ilole public a hilole bangem khat aum phat le house ten bol na ven duty hi akichinga house te to zia dana hierarchy na khat nong sep kha agep kha asaw khop meya zia ADC pen kha kinei lo hi jekin la funding la na het saw banga house taking a sum sikile na pe ko umlo hiya job card na sep na ding na pe ko chu specific ta ka job na sep sak ding na pe ko ya zo kha ivelak do thei pa je kha ji bridge to hi tribal affair po na hi je ken zia gap hi bangti bridge ding a him ti le neu khat apoi mo ma main ka hemia je ka chu ji chengchu kon ta thi mai ho ka ki pa ke
adot na hi chia lo ina non thei pi lo boy na ka tu utam tam kha oma wai te kon gen dia ken a big takina lamka hi driver ethics ka nei lo lua wai tak chia traffic rule les wi thei lo lua a big taka gari tunia le ya zinga hek ngal hol da di hun le thei lo u thunu na hol gari bang itai le inung lam kwa rong phut khadi o chi bang kilaw mai ma in chin yei kha hi thei le chu driving license khong kham mok isu ke herlan bagiam test om masalona driving test om masalona driving license kha mok isu ke le yei kha tu nei tu ten kha transport lam te kyanga yei thu kha vegle chin si de huai ka sama ma ma ya zala ma tui bo accident bang len anung lama ki pata phu tu te le voi huai hin chin tua mi la tam ta agari la tam u namun munna passenger de te kha passenger buten kha u namun munna u thunu na khol mo ku anunga tai te ya dia ala lau huai hi chi bang boi na bang ki tuak tam ma ma yei khati ta le civic sense ma ma ta sam lua nak lung kham hoi lua hi mai nala kha dasbin ki zang mai uta nana khenten a pool bang payu khenten au teng payu hoi tak chenga hoi kha nala kha apai di bang taka kha tui kha apai di bang taka kha pai thelo in hoi te ja kha ki block second sin lamlaya tui bang luang sek he bang leng apoi dena V Vumlunmang ina gian kha di kasama ma ai whatsapp kha to geno agala ki pata ngai dan a ya hoi ira atak taka tuak te de kha hak sain chin mo adik taka i underwear tan phabang le agudi kha adima omei ve hoi takin pho abu tu om kele hi chi tu khinchin tun public toilet hoi de nom le leng hoi bang kha a khenten ki ka na dia wazang dingu a hi ke la khenten a u teng hi na dia wazang dingu a khente bang in wa khen se mo ka yu chu woi ja ka civic sense khat ta samlo hanga helam bang la awareness ka hong tam de welan lam ka visioner hi chi bang a za ta koi ma suan hoi ma te a big ta pu ne khomang bang ni da nga general la ka kai la yon thei lai dia ma ka teacher lu yana hiya ama ma kai na mon wai pp ma kai tu sarkar la man sem officer top officer retired tengen hi bang ki pun khom teng kha chi bang program non bolwa lam ka visioner nong ki chiu hi thu pi ka sama ma ole bang teng le civic sense lam kha itak sap luat zia ka hiya hoi ba ka thil him in public property ka a sense of ownership ka nei lo theilo hanga wai te bang leng kha hoi lam bang leng sa da focus ina ni na hi le police station sa ka wai nin ki pai na chi pero akheta khel sia ta ke le demolish ai ke ngal le chu pai na di mun lem changom le kha wa pai di on chin om ke veten lan wai pe ha ki phiat khevet le ada nom di wai tak chiang ke kho sung dia bang ye yang tablam ka lak bang mi pi ki su khop na hin sin public ground om wai tak chiang a ptc de la headquarter police station la om hospital tan phau huap kha Suanmung college la om mi pi ki su khop na hin sin wai te hong ki su khom chang an nin bang yam pa ta mai wai kha job card holders sen kha job card na sem te wai teng bang leng aha khob phamo ke ve woi ja ka kha thil hi technical problem ki tuak tam ma engine hào sa thế bằng lấy cái hạ pan mà thôi vậy giờ cả izo lo le vậy baka ADC ten kha hi hoi ma wa cái lấy cái park ta mà ya lại dia mà sionu kha na se ma ai về garbage management to kisaya kha na se hoi ma chi le kon gen dia tu nei chi bang ki mu khomi hongom to zel le ya ki patin khangai dan tom lang piang dinga cô lắm cả tắc tắc anh tiếng tắc tiền học sẵn na cả tua ukha atam engine transport te lam kieng transport lam leng a hi thele driving license ka mi mok piak non ki he angai na ki ai chi le chu iki putlum tua limlum tiun ka ging ta alo huwa ya hi tunia gari le azinga feel honga harwi khong varau ni ho ki cha lam dia la ya tai mo aside piak na di lam le theilo atai na di lam le theilo ichi bang tama hi na konga hi he la bang aleng tu nei tu ten kha thu na project le chin hoi ding ka ging ta gen di tabla na he jan kon gen di ka ki pa ke
ông bà bèn Paul Hedin cái ngày sau nào là simple hay top mà thu ghen chẳng có cái health and sanitation khá áp làm được con ghen nha cái film mà chú Lamka cái pan ai rồi làm iman họ lệ tôi vài lui cái pan Mizoram làm khá khoan ở đây nuông mà chẳng càng ai làm khá lang với insedip để phong khasiat huai ma Burma bang sima Lamka ki pana teri mi ho le ya behang ekana chi kha itunga khwate khana det chuk mai abang chi lom ma hi chi ai de o ei thada ya khia chi ka ngai to cha na sol ka hoi lo lo hi se chu ka finding a hi tu ni le sorka lama ki pana policy na sep dan tengunun ge no akipa huai helele na hun lo a hi se chu kamu dan hi ya wana mi pi lam le tak sap su nei tham danon ge bang na Lamka vision in kha seminar ge na theloi tam pi non gen te wa hoi helele tua sanga public su kha revolution ba la pia awareness campaign body awareness atu number 1 Manipur ke ya hi Lamka ke ya hi government ke ya hi mi pin ichi thei de hoi kha apoi mo ma tua ba na mi pi wan tang ye legal awareness ka ita sama dena mi khatenon ge na nin he ka ya ka kaut na na pai le a siwa mi khatin kha are di ole ya angai ya play in sin ain veng pan bang chia ho ti ta lom ba za common play ve ka ya ka le ka thu ka chi tan thayin in veng te di stop lo de hi chỉ thấy phá lâu ai hoài băng đàn đều na tôi này làm cả yêu màu mi pi na pan lạc na thì na tắm ấy overall lại hết cái lệ làm cái tên này government mặc hết bằng giá kín in building hỏi pi tên gari hỏi pi tai dung này làm pin chỉ ta chín lâu, government là duty dấu lo hi, sĩ bằng một thầy nào mà, hoài giờ kiến tua imam thì chú mi pi là cả awareness campaign board, apoi một hin kamua, ala một buộc là thầy lâu, ý chiang nên, tôi phiเป็นหอมลูกดิพาร์ตเมนต์ค่ะอาวาลในเชียร์เราเนี่ยเดินสต็อปกอกบุลุนสต็อปกอกเลยบุลโลอิเล็กทริกฟีเป็นดุดักโล are imo puang na thelo government na ka se athon de savek e tribalism kha a hoi lo lam ta ka kisang ni dang lain British na America kha bang chiu hiam me chele brutal civilization ana ching ayua hoi dan la na lam kai khan la ni brutal ma in sin for the awareness must happen purely la hi lo hia to non gen te hoi veka department te malak na le hoi ma comment na kun lo lo hi iki mi kyang a e bodan polama e pa ya ile e Manipura e zo me te kwal tang kha in hoi le om lo sing tang khwa kar le ke mo lo bike le ke mo lo jeep le ke mo lo he ya Mizoram ba lut pe kho kon kho nau chi ka kha building om car om truck om pa ma khodung se ngo pa khai pak ma yu khwa khom e ngai to chiang na e lam chin lo na yak hi zo hia sol kar chin lo na yak e lam na e mo kwang na thei lo lo hi hia hoi ja kin sense of ownership ke chi kha mi lung sima e thun zo chiang a pan ke khang to di hia ka mo na chu Mizoram kha nu pe sing kwa hong ho le mo hong ho la kan ram a si wa tang war oi me ke hong ho le mo kan ram official kan ram chi be thayun sin en kha Manipur ka e chi khai khan mo bok ma hi si mo dan khat ka nei manin mon hoi ma Lamka vision ten kha na taka seminar khol hen ka che ke persona bung mala chang ko na ave awareness campaign bol le inahi to sa pai ha de to to kitanin government athada de omo ko na ro lo bang ta ka le Pherzawl le hang hay ada xem de mai ja hon xem le hi phun ngai lo luat nau le adik ta ken kha ngai sak ke tan lo le ka hi phun lo chang thei lo apila pil e kha khan mo bo khat ai che ka mo dan ai ke pa ke.
Okay, I'm afraid we have to wrap up the open house discussion now. We are very much behind schedule because there has been so many things to be said and done. I would like to request all the dignitaries on the dais to kindly go back to their respective seats. There is one more item, summing up and vote of thanks from Pu, called the retired NG Sidlau, Vice Chairman, Vision Lamka.
Thank you for the time. I take this opportunity to thank everyone who's participated in this seminar. Especially like to mention Pu Vumlunmang, Dr. Vumchinpau, and Pu Haulianlal and Pu Dr. Fimate for contributing and sparing their time to come and share their thoughts with us, which I think we have greatly benefited. I'll also like to thank the audience for being a fantastic audience and being a patient listener and bearing with us for all the shortcomings that we have. I'll also like to thank the volunteers. There is a NES and Highland Group, yes. And also friends from the media, without which this function not been a success. Thank you so much. I'll not take more time now because everyone is in a hurry. Wish you all the best and please go back from here with a challenge. Remember the 1 lakh rupees. Thank you.